burden of approximately $600 million a year in our country. In many states, the incidence of diarrhea, enteric fever, viral hepatitis, and cholera has stayed at the same level over the past decades owing to the quality of water. Quality assurance checks are lacking not only in rural areas, but also in many parts of our metros. Less than 50% of the population in India has access to safely managed drinking water. Understanding the gravity of this situation, the government of India under the Prime Minister Narendra Modi's leadership has been relentlessly working for ensuring safe water supply and has initiated mega schemes such as Har Ghar Jal to ensure clean piped drinking water to every household. The government of India has also established National Water Mission as one of the 8 national missions under the National Action Plan on Climate Change. The main objective of the National Water Mission is conservation of water, minimizing wastage, and ensuring its more equitable distribution both across and within states through integrated water resources development and management. According the high priority for transformation of drinking water infrastructure and revival of its resources, the Ministry of Drinking Water and Sanitation was restructured as new ministry named Jal Shakti, Power of Water, in 2019. However, while the government is pursuing this agenda with high priority, the council believes that for any public health or social initiative to be successful and create sustainable impact, it needs the active participation of all stakeholders, including the common citizens. This is also amply witnessed in this year's theme of the World Water Day, which implores world community to be the change you want to see in the world. We at the council relentlessly work to motivate and inspire people to join our endeavors for better and a healthier world for all, and the Jal Jeevan Conclave is a step towards that. Through the conclave, our aim is to bring all relevant participants together and discuss on the various aspects of clean water, its impact on health and hygiene, and even distribution to each and every person, and to address the challenges that we see in this regard. Also, we seek to educate and empower people by creating relevant awareness on significance of clean water and its impact on health, and work proactively to protect our water bodies from all sorts of pollution and hazards that give rise to a number of NCDs and other health crises. So let's commence our opening session without any further delay. The session will discuss about the role of clean water in managing healthy lifestyle, hygiene, and NCDs. So please join me in welcoming Ms. Mubin Mulji, partner Amson's Technologies, as moderator for this session, who will be interacting and trying to understand this issue with our very esteemed panelists today. So over to you, Ms. Mulji.
Thank you, Mr. Kamal Narayan, CEO, IHW Council. With your kind permission, I request to proceed with our esteemed initiative by IHW Council, the Jal Jeevan Conclave. And the topic of our today's discussion is impact of clean water in fighting hygiene and sanitation, NCDs, and chronic water-borne diseases. Warmest greetings of the day to one and all. Best wishes on World Water Day. I now take great pride in introducing to you all our esteemed, highly qualified and successful panelists of the day. Let me start with Dr. N.B. Mazumdar. This gentleman is Chairman, International Academy of Environmental Sanitation and Public Health. So we warmly welcome you on board. Please take a few minutes to connect with our audience. Dr. N.B. Mazumdar.
Good morning. It's a great pleasure to be here. And I'm thankful to the organizers for giving me this opportunity. Now, as you mentioned, I'm with this organization, IAESPH in short. So we are basically into, water, WASH, so water sanitation and hygiene. And we are with, as a consultant in the consultative status with ECOSOC as well. And we work in all these areas. in practice also. Say, this is March end, so a lot of March rush. So right now, we have 3 projects lined up for finishing line within this 31st March, 2 of them being water related. So 2 small projects for drinking water supply in rural areas, one in Tamil Nadu and one in Uttar Pradesh. So that is how we are working. So grounded, but at the same time, we are into consultancy and capacity building as well. And I had retired from HUDCO in the year 2005. So almost 18, 19 years. So that's about my introduction. Thank you very much.
Excellent, sir. Thank you so much. Welcome on board. Next, we have with us Dr. Jugal Kishore. This esteemed gentleman is Director, Professor, and HOD Community Medicine, Vardhaman Mahavir Medical College and Safarganj Hospital. Sir, you can take a few moments to connect with our audience. Dr. Jugal Kishore. Sir, are you online? Okay, so Dr. Kishore will join us in some time. Let's go to our next esteemed panelist. We have with us Dr. Sanjeev Bagai, pediatrician and chairman, Nephron Clinic. So we welcome you and you can connect with us all.
Hi, good morning. Thank you, the organizers, for having me. My name is Professor Dr. Sanjeev Bagai. I've been in healthcare space for now close to 40 years. I'm the chairman of Nephron Clinics, which is based in New Delhi. Previous to this, I was the CEO of various large corporate private hospitals in Delhi, including Batra Hospital and Medical Research Center. I was the CEO of Radiant Life Care Delhi and vice chairman and director of Manipal Hospitals in Delhi at Dwarka. My main expertise, of course, is in pediatrics, pediatric nephrology, digital healthcare, preventive healthcare, which also includes prevention of waterborne diseases, and a lot of work on the digital space with regards to digitalization of smart healthcare. I think this is an extremely important topic, and I'm very happy to be with you.
Most welcome, sir. We also have with us today Dr. Santasabhoj Das, who is scientist at ICMR, National Institute of Cholera and Enteric Diseases, Kolkata, and Director ICICMR NIOH Ahmedabad. IHW Council welcomes you, sir.
Good afternoon. Am I audible?
Yes, sir. Yes, sir.
Yeah, it's great to be with this conclave. It's as my previous speakers have highlighted, its importance cannot be overemphasized at this point of time. Although we have a lot of development going on, as the IWH CEO has mentioned in his introductory remarks, that the incidence of most diarrheal diseases, childhood diarrheal diseases, they have not really decreased, although mortality rate has decreased significantly. So, and then, we are having newer problems, newer contaminants. So, I am attached to both the institutes. The first institute, which is the name suggests, cholera enteric disease, obviously it works with the diarrheal disease itself. And my personal area of work is with typhoid. But in the new institute where I'm the director in charge, there I am, this is an occupational health research institute.
Excellent, sir. Thank you so much for introducing yourself. Next, we have Mr. Bijesh Kantarkandi, Program Coordinator, Water Aid India. So we welcome you on board. Are you online, sir?
Yeah. Can you hear me?
Yes.
Can you hear me? Yeah.
Yes.
Thank you, Bhupen. And thank you for the council for the invitation. So I work with Water Aid India. Maybe some of you know Water Aid India also work with water sanitation hygiene. We work around 11 to 12 states across India, both in rural as well as urban. We have 2-3 thematic, means almost 4-5 thematic priorities. We look at drinking water, sanitation, rural sanitation, urban wash, then health and nutrition, and then wash in schools. So our aim is basically to ensure wash with an adequate wash with a quality standard in this rural and urban community. I belong to the southern states where we are implementing the program. So I look after Telangana programs as well as Andhra programs. And once again, I looking forward to the discussion which is going to happen right now. Thank you so much.
Thank you so much, sir. We welcome you. Next, we have with us Ms. Dr. Mona Lisa Sahu. She is Associate Professor and Head of Department Occupational Health, All India Institute of Hygiene and Public Health. Ma'am, we warmly welcome you on board as panelist of the day. Please, if you can introduce yourself to all of us.
Thank you, Mubin, and namaskar, everyone. It is my great privilege to be here today for this water conclave. This is a topic very close to my heart. And as Ms. Mubin introduced, I am from All India Institute of Hygiene and Public Health. Our is one of the first, it is the first public health institution of Southeast Asia, and we are more into the capacity building. So our occupational health department is also one of the oldest in the country, and now we are trying to upgrade into the Department of Occupational and Environmental Health. So currently we do capacity building for more than 60 PGs each year for occupational and environmental health, and we are trying to introduce newer courses also. And currently we are doing 3 projects. One is an Indo-Swedish collaboration on climate change, and then another one where here we are just discussing how climate change is impacting our indigenous population as well as indigenous population in Sweden. And then another project is a Niti Aayog-led project, and the third one is in Sundarbans. It is about, again, climate change. So how climate change is impacting water availability and our health. These are basically the areas in which we are working currently, apart from major occupational health diseases. So thank you.
Thank you so much, ma'am. Also, your backdrop is extremely impressive. Most welcome.
Thank you.
Next, we have with us Dr. J.K. Basu, Additional Medical Superintendent, Lok Nayak Hospital, with us today. So we warmly welcome you on board today's discussion.
Thank you, ma'am. Am I audible?
Yes, sir. Yes.
Thank you, ma'am. And welcome to all the dignitaries also. I'm Dr. J.K. Basu. I'm here as an additional MS in Lok Nayak Hospital, which is one of the largest hospital of Asia. And it is a tertiary care center we are working here. I've done MBA in the disaster management also. And right now I'm seeing the academic post. Thank you.
Most welcome, sir. Dr. Jugar Basu is online. Dr. Jugar, are you online or should we proceed? I think we'll just wait for him. Let me just first proceed with. Yeah, sir. Most welcome. Sir, if you could please introduce yourself to us.
Me?
Yes.
I'm Dr. Jugal Kishore. I'm Director Professor in Head Community Medicine in Vardhaman Mahavir Medical College, Safdarjung Hospital.
Most welcome, sir. Okay. Now let us proceed with our Q&As and the most awaited part of this conference. My first question is to, as you all know, ladies first. So my first question is to Dr. Mona Lisa Sahu. Dr. Mona Lisa, what, according to you, ma'am, is the impact of climate change on safe water availability? Ma'am, are you there?
So thank you, Mubin, for this question. I will start with a childhood story. We all have heard in our childhood the story of a hummingbird and a forest fire. So I would say the current climate crisis is like a forest fire that is threatening to engulf our planet. And we have to take inspiration from the story of the hummingbird to take action in the face of this climate crisis, much like the hummingbird did in trying to put out the forest fire with its tiny beak. I would like to emphasize that we all need to realize that climate change is a reality and it is currently causing devastating effects on our environment, be it rising sea levels, more frequent and severe weather events, loss of biodiversity, and destruction of many habitats. So these impacts, they are not only threatening the survival of many other species, but they're also posing a significant risk to human health and well-being. Not only they are affecting our health, they are also affecting our ability to grow food, our housing, our safety, and our work as well. And I would say that some of us are already more vulnerable to climate impacts, such as the people who are living in small island nations or those who are living in the coastal areas and especially in the developing countries. So we must all do whatever we can, no matter how small, to combat the effects of climate change now. And here, what is the role of water in this climate change phenomena? Though the climate change has many forms, but you will see that its major impact will be seen through the water sector only. So how? Because water is foundation of life and it is essential for our agriculture, our energy production, industry, and most importantly, human consumption. Now, climate change is putting pressure on water resources, and with more frequent severe droughts and floods, it is causing water scarcity, which is again leading to food scarcity. It is very well said that every fifth disease is caused by water, but I would like to disagree here, because I would like to say that every disease in some or in other form can be traced back to unsafe water and sanitation. So as we all must be knowing that classically, based on transmission of water-related diseases, these diseases are classified into 4 categories. First is water-borne diseases. Second is water-based diseases. Third is water vector diseases. And fourth is water-washed diseases. Now, water-washed diseases, we all know they are caused because of lack of water and personal hygiene. So diseases like scabies, trachoma, and fungal infections. So these are all water-washed diseases. Now, waterborne diseases, we all know it is because of consumption of contaminated drinking water, maybe because of a pathogenic microorganism, or maybe it can also be because of leaching of some heavy metals like arsenicosis and fluorides, etc., which will lead to diseases like cholera, typhoid, giardiasis, dysentery, hepatitis A, and many more. Now, water vector diseases or water-related diseases, many people say, so these are because of biting of vectors like mosquitoes, and they transmit parasites like viruses, bacteria, protozoans, worms in human bodies, and it will again result in diseases like dengue, Japanese encephalitis, malaria, etc., etc. And the fourth one is water-based diseases, in which the pathogen has some life cycle which is spent in an aquatic animal or organism, like in fish, or in like guinea worm disease, or through schistosomiasis. So these are various kinds of diseases which are directly through water, traced back directly to through transmission through water. But there are other diseases also, and climate change will increase these diseases many folds, and many other non-communicable diseases will also be added. Now the question is how. So first, as I already spoke about, it is water and food scarcity. As per IPCC's 6th report, although overall agricultural productivity has increased globally, climate change has slowed this growth over the past 50 years. Now, globally, ocean warming and ocean acidification have adversely affected food production and also shellfish aquaculture and fisheries in many oceanic regions. Increasing weather and climate extremes have also exposed millions of people to acute food insecurity and reduced water scarcity, reduced water security, making it difficult for people to access safe drinking water. Now, this lack of this safe drinking water and poor quality water will again lead to waterborne diseases such as cholera, typhoid, and the largest impacts will be observed in the locations or communities which are developing or which are compromised or vulnerable in some or other way, like in Africa, in our Southeast Asia, Central and South America, and especially the small island or oceanic countries and the Arctic regions. So roughly, as Dr. Kamal already told, half of the world's population is currently experiencing severe water scarcity for at least some part of the year due to climatic and non-climatic drivers, and 40% of the Indians, it is estimated that 40% of them will face water scarcity by 2050. Now, jointly, sudden loss of food production and access to food compounded by decreased dietary diversity will also have increased malnutrition, and various other incidences of NCDs will also rise because of this lack of dietary diversity and food insecurity. Now, the second major way in which this water scarcity, this water crisis is going to affect us is through urban flooding. Now, how? So, India is, as we know, is one of the most vulnerable countries globally in the terms of populations that will be affected by climate and sea level rise. Our cities, like our major cities, Mumbai, Kolkata, Chennai, Puri, Vizag, or Visakhapatnam, and Cochin, they are all situated in coastal region. So if the global warming passes 1.5 degrees Celsius, both Ganga and Brahmaputra basins will see flooding. And not only that, the monsoon precipitation is also projected to increase in the mid to long term over Southeast Asia. And there will be around 20% increase in rainfall on Southeast coast than what was compared to in early 1850 or 1900 levels. So this will lead not only to floods, but urban flooding, and water quality will also be bad due to sewage overflows and agricultural runoff contaminating water. So again, there will be waterborne diseases, and rising temperature and algal blooms will further deteriorate the quality of water. Now, these floods and due to climate change, the cyclones, they will also severely affect our infrastructure related to water as well as our health infrastructure, which will seriously affect our healthcare delivery system. So it is projected that by the middle of the century, around almost 35 million people in India will face coastal flooding, and the economic cost will be one of the highest in the world, with direct damage of more than 24 billions. So rising temperature and increasing precipitation will also increase glacial lake outbursts, floods, and landslide, further affecting human lives. Forest fires will also increase due to increased hot wave conditions. So all this will lead to increased heat stress, urban flood, then salinity intrusion, and then it will affect vulnerable communities, and it will lead to, it may get advanced to such a point where whole communities will have to relocate. Just imagine if whole of the Kolkata has to relocate to somewhere else, and the number of climate refugees is expected to rise exponentially. And if we talk about the water-related SDG 6, then currently world is seriously off track on SDG 6, and the latest data shows that government must work on average 4 times faster to meet this goal on time. So at the end, I would like to say on this World Water Day that let us remember the story of the hummingbird and take inspiration from its determination to do whatever it could to save the forest, and let us do our part, no matter how small, to protect our planet's water resources and combat the effect of climate change. Let's play our part and do whatever we can. Thank you.
Thank you so much, ma'am. Excellent analogy of the hummingbird, doctor. Thank you so much. So my next question was about the water-associated diseases, but I guess you have answered that as well in the first answer itself. So we'll move on with our next question and our next panelist of the day, Mr. Santasaboj Das, sir. Sir, are you online?
Yes, I'm online.
Yeah, so sir, my question to you is, what is NCD risk And can you tell us, and next I'd like to ask you about unsafe wash time. What is NCD risk due to unsafe wash time? Can you please tell us?
So, as you know, my previous speaker, Dr. Monalisa, has mentioned that water mediated diseases could be different. Okay, it could be waterborne diseases, it could be water wash diseases, and like that. So, generally, waterborne diseases, we consider microbiological diseases. So water contamination from human disease perspective is usually we think about microbiological contamination, like leading to different diarrheal diseases like cholera, typhoid, like that. But then there are other contaminants which can also spread through water. So other than microbiology, even bacterial, there are. So to cause an infectious disease, that we need a live bacteria, live organism, but it could be bacterial toxins or some other bacterial products that can cause also disease, which may not be an infectious disease, but a non-infectious or non-communicable disease. Okay, so under non-communicable disease, you can have cardiovascular disease, you can have a neurological disease, you can have metabolic disease, you can have cancers. These are all non-communicable diseases which does not spread from one person to another. So now this is one thing. And then there are physical agents. Most importantly, there are chemical agents. So, with all these different industries, and not only industry, household and community activities, as well as industrial activities, produce and release thousands and thousands of chemicals in the environment, including water. Many of them are responsible for serious human diseases, which are non-communicable diseases. And all spectrum of diseases can happen because of them. So say, for example, we know about arsenic poisoning, groundwater poisoning with arsenic. We know that, Southeast Asia, huge population is under arsenic poisoning. It's like some estimate is around more than 2.5 million people. More than 225 million people are exposed to risk. And only in Bangladesh, there are around 25,000 deaths every year due to arsenic poisoning. So, but arsenic is not only, and then arsenic can cause liver disease, arsenic can cause cancer, okay, arsenic can cause neurological problems. So there are all sorts of NCDs can happen. Then other than arsenic, we have heavy metals like say lead, cadmium, chromium poisoning. Lead poisoning has come up as a very big issue in the subcontinent. And it is being, and lead is, you must have heard recently IPCC had a conclave in Delhi end of the last year about the lead poisoning, alarming lead poisoning in Indian children. And an estimate suggests that, an average Indian children is losing 4-point IQ because of lead poisoning. So, and water is one of the major source of lead poisoning. So other than, intellectual disability, lead poisoning can also cause hypertension, other cardiovascular diseases, and also it can cause, there is lead nephropathy, so it can cause renal disease. So other than these things, arsenic or lead, there are many other chemicals. I mean, there are pesticides, there are many organic, like say fluoride, there are chromium, there are radioactive agents like cesium, uranium. They can contaminate water. And then there are a group of contaminants which are called, EOCs or emerging organic contaminant. They have pesticides, they have different pharmaceuticals which can cause water contamination. Now, say all these things that can cause, diseases, mostly diseases, any organ can be affected, but most commonly investigated and most seriously affected organs are one is heart, cardiovascular system, another is metabolic diseases, another is kidney diseases, and then neurological and intellectual ability, and then bone diseases. So all these diseases can be caused by this. And then last but not the least is the total dissolved solid, or TDS. So, that is also another problem, and more than 1 billion of world population is actually at risk of TDS. And that can also, has been shown to cause hypertension, particularly in pregnant women, which, there may be, that last trimester, third trimester hypertension, preeclampsia, that can cause, serious problems. So, there are a large number of diseases that can be caused by, other than, live microorganisms, chemicals, radiological agents, and even, sediments, physical agents that can also increase, algal toxin release, which can cause, swim water sickness. So there are a large number of NCDs that can be caused by, and NCDs are now, even in LMICs and low-income countries, it's around 70% of diseases are now due to non-communicable diseases rather than communicable diseases. And so
thank you so much.
Pollution contributes a lot.
Thank you so much, sir, for your extensive, very precise answer. Thank you so much. My next question, I'm going quickly to Dr. J.K. Basu because we don't have much time left. So I'll go to Dr. J.K. Basu. My question for you, sir, is what are the effects of unsafe water on health? Dr. J.K. Basu, are you on?
Thank you all. Thank you, ma'am.
Thank you. Thank you.
As you all know, that climate change is disrupting weather patterns, leading to extreme weather events, unpredictable water availability, exacerbating water scarcity, and contaminating water supplies. Such impacts can drastically affect the quality of life of people, especially the children. And rising temperature can lead to deadly pathogens in fresh water sources, making the water changes dangerous for people to drink. And there are slew of waterborne diseases. And it's a very alarming, actually, this is alarmingly groundwater in 1/3 of the India's 600 districts is deemed unfit for drinking, with dangerous levels of fluoride, iron, salinity, and arsenic. And about 65 million people suffers from fluorosis, a crippling disease caused by excess fluoride, a condition commonly found in Rajasthan state region in northern India. And the United Nations also ranked India's water quality at a horrifying 120th place among 122 nations in the quality of water. And WHO organization estimates that 80% of the diseases water worldwide are waterborne. And around 3.1% of the deaths in the world are due to unhygienic and poor quality of water. And the worst sufferers are children below 5 years of age. And as we know, poor quality water becomes inevitable when water gets polluted with industrial waste, human waste, animal waste, garbage, untreated sewage, chemical effluents, etc. And drinking or cooking with such polluted water leads to waterborne disease infections such as amoebiasis, giardiasis, toxoplasmosis. And contaminated water also carry viruses such as hepatitis A, hepatitis E virus. Bacteria like E. coli can be passed from hand to hand, such as via vendors of street food or food handlers. By someone carrying E. coli bacteria can lead to food poisoning. And the results, dangerous diseases like cholera, typhoid fever, other waterborne diseases include diarrhea, dysentery, polio, and meningitis even. And rural populations in India are more at risk from waterborne illnesses because safe water availability to them are really very compromised, and a challenge to the government also to provide Har Ghar Jal Jeevan and all, Jal from Null. There is a slogan by the government. But everyone faces the risk of polluted and contaminated water. Waterborne illness can affect anyone, anywhere. The risk is more for infants, younger children, elderly, and the patients of diabetes, chronic diseases of heart disease, kidney, etc. And precautions we should take to prevent waterborne diseases To ensure the water is visibly clean and free from sand and silt, we can filter the water to get rid of visible dirt, drink only clean, safe water, either potable water or water filtered through water purifiers, get water firing devices. There are a lot of filters, RO units, etc. Regularly serviced and maintained. Ensure stored water is germ free. And we can add antiseptic liquids also, Dettol in dubious looking bathing water, especially not drinking, bathing water. Hand hygiene, regularly wash hands with soap after returning home, after using the toilets, before and after preparing food, before eating or drinking anything. Teach hand hygiene to children. Children should make it a habit to always wash hands when returning home after playing games. Ensure food washed thoroughly, cooked. Use disposable glasses, plates whenever possible when eating outside food, particularly street foods. Avoid eating stale cooked food in the home. Unrefrigerated food kept exposed outside for long hours or so. And these are few things by which we can ensure good quality of life, which can be affected by the unsafe waters. Thank you, ma'am.
Thank you so much, sir, for the excellent insights. Now, my next question is for our esteemed panelist, Dr. Jugal Kishore. So my question to you is, chronic waterborne diseases, how do we handle or tackle these head-on? Your views on this, sir, please.
Chronic waterborne diseases, like which one? There are so many, like we have the amoebiasis, or could be the exposure to metals, which I've already discussed in detail. So there are many diseases which are can lead to, which are having the long effects. Like we have the fluorosis and even the arsenic. But the problem is, my concern to this is that water is now the surface water, which is less than 1% of the total, which is available for us for consumption. It is totally polluted. You go anywhere, you'll find that the water, particularly India, what surface water we have, which is known as a safe water. And if you're consuming it, it is going to have the continuous effect and have the chronic effect. Now, remember that we already know that microplastics are there in the water, and which is now found in all types of source of waters. Unfortunately, the water is clean, but we can't clean some of the metals and also the organic compounds and microplastic. Even it goes deep down in our blood and organs and give rise to many causation, particularly the cancers and these effects, like on the fetal changes. So there are major issues. What I personally feel, the pesticides and microplastic, which are continuously throwing in the environment and creating problem to our water. Another one is the RO, which we are using, the reverse osmosis methods, which are actually leading to deficiencies states, like the minerals are not, people are not getting those minerals and leading to deficiency states, like the osteoporosis, and these are the continuously, taken out from the water because of our system of providing the water. There are major issues, it is just talking on one day is not going to solve it. Just imagine we have the sewage system, which is not there at all. Effluents is also, not treated well. And none of our big cities, like the metropolitan cities or mega cities like Delhi or other, they don't have full coverage of the sewage treatment or maybe effluent treatment. So we are abusing water like anything, and disrespecting that it is the essential component of our life. Therefore, continuous efforts are required from all sides to be active and to, deliberate upon that water has to be safe. Otherwise, I don't know what is going to happen when we look at that, what are the diseases which can be due to the unsafe water supply. So it's a serious concern and serious thoughts are required. I personally feel that, just one day discussion is not enough. We have to talk, everybody has to talk, and government has to take very serious note of it, that none of the water should go to river without proper treatment. Uh, then only I think we can have some hope. Otherwise, conditions are complicating. We have uncontrolled development, which has led to the climatic change, and the environment is such that it has effect on everything. Like, if it is going to get affected, then a human being and animals are going to be affected, and the forest is going to be affected. So we are all interconnected. So anywhere we are doing the wrong is going to ultimately come back to us. So through your medium, I just want to say that really serious efforts are required from all the sectors to save our water, which is essential for our life.
Absolutely, sir. I think we all 100% agree with your views. It is definitely not a one-day job, but I think with conferences like these, we definitely are on the path. Thank you so much for your insights. So my next question is for our esteemed panelist, Mr. Bijesh K. Sir. Sir, are you on? Mr. Bijesh, so my question to you is...
Yeah, tell me.
Yeah, what exactly is WASH? Please tell us.
Yeah, thanks. I think we are already the time. So what WASH as a larger package we call water, sanitation and hygiene, which is very key. In the rural area, we always, now our previous panelists always talked about the diseases, the reason for contamination, etc. But WASH is very important because we are trying to sort of a break. So there is we always know a fecal oral route of transmission of all the factors which cause the diseases, including bacteria and other microorganisms. So WASH is something we try to bring it in terms of having a safe and adequate. So both safe as well as adequate is very important in terms of drinking water, sanitation and hygiene. So we are talking right now on water. Water is very key in terms of ensuring hygiene, especially when we talk about breaking the fecal oral route of transmission. So in the rural area, the availability of water have been increased, or the mission of JGM is supposed to have adequate and safe water. The reason or the issues related to water is already shared by our previous panelists. So we are looking at to ensure that water, means water, sanitation, hygiene, which are one of the major cause or be the important cause of all the diseases which primarily transmitted through the water. So safe sanitation is, which is very important through several programs of the government, including Swachh Bharat Abhiyan. They were trying to improve the sanitation. I'm not talking about sanitation, but improve the safe sanitation in the country. Now through the JGM, they are trying to improve the availability of safe as well as adequate water for the country, for the population. But so WASH is very important in terms of, so that's the reason WASH have a direct impact on the health. The WASH work, what we are doing all over the country is to break that fecal oral route of transmission to ensure that the affected population will be reduced so that they need sort of a medication in the later. So it's also pre-precautionary measures what we are. So WASH is so important. But I leave this with the thought that especially in the JGM, And all the previous panelists was talking about, educative drinking water is needed, all are contaminated, etc. But right now we have to live with that. So, but the issue is how to move forward in that. So now with this mission of government mission of Jal Jeevan Mission, always they are ensuring it adequate water. Safe is something they are looking at water quality monitoring through community-based organization or the institution itself who can monitor it in such a way. But I want to share here is now the water which is providing, especially in the rural population, is coming more than 80% coming from the groundwater. The groundwater have any issues in terms of the chemical contamination, which one of the panelists already talked about in terms of arsenic, fluoride, nitrate, etc. and etc. Now the question is, now if we keep on tapping from the groundwater, then how long? So we always talk about sustainability aspects, and I think Mubin, you also touched upon SDG 6 in providing a sustainable water and sanitation. So sustainability is always questioned in it. So providing this, because these are all linked with health. So ensuring that sustainability is important, and our programs and all the efforts should be more towards sustainability, including the source sustainability. We are talking about groundwater which has been extracted. So how to ensure the source sustainability of the groundwater? We already talked about the surface water, the quality, etc. How to make them safe. So a lot of issues are there, and the madam talked about climate change. So climate change is above all, it is getting even worse. So a lot of things to look at, and wash is a key thing which have a direct impact on health and also have an immense impact with respect to climate change as well. So I just leave the thoughts here. Thank you so much, Mubin. Yeah.
Thank you so much, sir. Excellent insights. Lovely answer. Our next panelist we would like to go to is Mr. N.B. Mazumdar, sir. Sir, are you on? Mr. Mazumdar, sir, I'd like to ask you. Sir, are you there? I'd like you to on your video and unmute yourself.
Yes.
Yeah, sir. Sir, my question to you is, what are the sources of pollution potential of concerned sources of water?
Okay, that's a nice question and a very important one. But I'd mention one thing. You see, what Dr. Jugal Kishore had just mentioned, that unless we are careful, things are going to boomerang on us. So therefore, we must be very careful and, thoughtful about our actions. Now, coming to the sources of pollution, these could be usually of one of three types. One is the biogenic or the biological contamination. Second is the anthropogenic contamination, and third is the geogenic contamination. Now, the first one is usually common in low-income countries where the level of sanitation is still not up to the desired level. Now, the fecal-oral route of spread of contamination creates considerable disease loads of waterborne diseases, as has already been discussed. So I'm not going to go into detail of those things. Plus, the unscientific disposal of municipal solid waste and wastewater, there is the municipal wastewater or sewage. Without appropriate treatment, this also leads to huge pollution of water, land, and air, all the three. The second is the anthropogenic contamination. This is our own doing, that is, which is related to human behavior. Now, we are squarely responsible for the same. The most blatant example are improper disposal of industrial waste, some of which may be very dangerous, especially due to presence of heavy metals in solid or liquid forms. Toxic gases add another dimension, although today we are focusing on water. It's very difficult to entirely get rid of such chemical pollutants, but different methods have been developed for treatment of such waste materials, but they are usually highly technology intensive and highly capital intensive. Plus, their requirement of skill set, that also is very high. The O&M cost is also very high. Even land areas contaminated with difficult industrial chemicals, they become a liability. Now we, from time to time, we do hear, mostly in our country, of course, we have been neglecting this issue, that industrial areas where some very polluting industry was there, once they finish and move off, the land which they leave behind is highly contaminated, which in turn will lead to so many other contamination, including rainwater percolating and contaminating the groundwater. So all these need to be taken care of. Then is the geogenic contamination. This, of course, is not directly in our hand. This is a very complex, geological formation related thing. But yes, sometimes very high level of extraction, very sudden high volume of extraction precipitates some geogenic contamination as well. Now, there are ways which can be done to, bypass this. I'll come to that example after a while, although the time is very little left. Oh, only 6 minutes. So, okay, I'll be quick. The other thing is recycling of wastewater, as Singapore has shown, knee water. So it can be done when water sources are less, as has been mentioned by even Mr. Kamal Narayan. So we have to see how recycled wastewater can be utilized in the best possible manner. And then to top it up, rainwater harvesting to bolster the water resources. Now, although the time is very little left, I'll just give you one example. You see, in some places, the aquifers are contaminated with geogenic contamination. In West Bengal, for example, if you have it, one side is contaminated with fluoride, the other is arsenic. Now, our organization has done a lot of work. We have done about half a dozen of small drinking water facilities where we have used the surface water, not going into the complicated chemical treatment facilities. What we have done is we have tested the surface water where perennial sources of surface water was available in adequate quantity. So that water was tested and we found that this could be treated with simple systems. So in about half a dozen places, we have set up those facilities which are in the range of about, they are producing about 5,000 to 10,000 liters per day of drinking water by not going up to RO, but going up to ultrafiltration level. And we have tested that the water is safe for drinking. And in arsenic contaminated areas, it has really worked very well. In about a year, the disease load has actually reduced. And another thing is, we have also shown that the communities represented by their cooperatives, they are managing these facilities very well in the last 6 to 7 years. And they are, in some of the facilities, they have actually expanded. So that's a great, solace that we can actually think about those things and plan in a holistic manner. And in many places, like in Eastern India, where there is adequate rainfall, we could or we should use surface water after testing it thoroughly. Thank you very much, because I think the time is almost up.
Thank you so much, sir, for the extensive, excellent answer. Truly remarkable. Thank you, sir. Mr. Sanjeev Bagai had to rush, so now we would like to close. It is rightly said that when we discuss, we open our visions to possibilities unlimited. And when the great minds like our esteemed panelists get together in a discussion, then the outcome is truly remarkable. And we thank IHW Council and its initiative of Jal Jeevan Conclave for this wonderful platform. Thank you all for your patience, your time, and your very valuable insights. on these subjects. I thank you, esteemed viewers, on behalf of Jal Jeevan Conclave. Thank you all for your insights. We hope that we have added a lot of informative value to one and all with the help of this initiative by IHW Council. With this, thank you all presentees and for your presence and your participation. I am Mrs. Mubin Mulji, partner of Amson's Technologies, manufacturers and pioneers of ozone generators, signing off. With this, I would like to hand over to our next moderator, Dr. Ajit Salvi, to take it further. Thank you so much.
Thank you very much.
Thank you very much.
Thank you, Mubin.
Thank you, sir. Thank you.
Let us check. I think Anshuman, you have to just find out. Yes, sir. Welcome, Ajit. Then,
am I audible?
Yes. Just take a fast audio and video check. First, start with Ajit. Ajit, just check your audio.
Yeah. Hi. Good afternoon, everybody. Is it clear?
Good afternoon. Yes, you are audible. Thank. Nice. Mr. Ajay Pradhan, just check your audio.
Hi, Dr. Ajit.
Hi. Yes,
good afternoon.
fine.
Good afternoon, everybody. Yes.
Then Anshu.
You can start.
Anshuman will join after some time, no?
Yes.
Okay. So, good afternoon, everybody. It is a nice panel discussion, and with the subject that is what is the session highlights what we have to talk about the urban and regional challenges of safe drinking water. To begin with the thing, really speaking, I welcome all with the wishes on the World Water Day. Today is the World Water Day. No doubt in across the India, all are celebrating New Year also in different part of the country. So to be very frank, to begin with, I can say to give the brief about this particular program, Integrated Health and Wellbeing Council, that is what IHW, under its mission, Good Water for All, has organized 3rd edition of Jal Jeevan Conclave on the occasion of World Water Day. The conclave is focusing on development of action plan to fulfill vision of the timely Har Ghar Jal and bring government authorities, international and national organizations, development foundations, corporates, private companies, regional agencies, proactively working at district and Gram Sabha level to support, contribute, and implementation of Jal Jeevan Mission in providing safe and clean drinking water in rural area of India. Say, in general, we can say water is the elixir of life. It has a quantitative limitation and qualitative vulnerability. Water is essential for manufacturing, agriculture, commerce, many types of energies, economics, and existence of the human and other life forms. However, one should not forget that water can never be manufactured. Cloud seeding methodology still has long distance to go. In India, you'll take the situation alarming. 16% global population share and India has just 4% of world's fresh water. Thus, resulting in the freshwater crisis, around 76 million are without access to safe drinking water and 21% countries diseases are water related. It is estimated that waterborne diseases have economic burden approximately $600 million in a year. To address all this and other issues coinciding with the United Nations Sustainable Development Goals 2030, central government has planned and launched Jal Jeevan Mission, which much needed focus on Har Ghar Jal under Jal Shakti Abhiyan, Jal Jeevan Abhiyan. Government is focusing on community managed drinking water, including water safety and security planning at institutional level. Developing improved water quality monitoring system and strengthening operation and maintenance of water supply infrastructure. Today's session, whatever we are here, we will be discussing about the urban and regional challenges of safe drinking water. We will also cover the issues related to fast rate of groundwater depletion in India, as India is the world's highest user to this source. The discussion will put spotlight on various challenges in rural and urban water sector, water supply, and possible solution for the same. This year, the theme for the World Water Day is accelerating the change to solve water and sanitation crisis. This is the theme. I think that the end of the discussion or end of this, or you can say result of this panel discussion will definitely give some direction for accelerating the change. That is what I'm expecting. So I welcome you all dignitaries, all expert and esteemed panelists. So let me introduce all panelists in a short way. I'm sure it is very difficult to give the introduction of each and every panelist in a detailed version because all are really having lots of experience, good, excellent educational qualification and on-site experience, what I found. But in short, I'm just trying to just update everyone. To begin with, I think Anshuman will join. Anshuman, he's the Associate Director of Water Resource TERI. He is working in the field of water sector since last 25 years. His key qualification include MTech in Energy and Environmental Management from IIT Delhi. His experience is in integrated water resource management, water use efficiency, and so many. He has carried out several studies in water sector. He has been the member of several advisory committee, such as CSIR Monitoring Committee. He has presented several research papers. I welcome Anshuman on this panel for this panel discussion. Our second esteemed panel member is Mr. Ajit Fadnis. Ajit Madhav Fadnis, basically civil engineer, having experience of 30 years in the field of water, sanitation, and natural resource management. He is a founder director of Primo Infrastructure Development Consultant Private Limited, which provides technical services to rural and urban infrastructure development projects, and also capacity building and institutional development services in WASH and NRM sector. He has worked nationally and internationally in various countries, especially in Africa. He has worked at policy, program, and project level with central government, state government, and local bodies, multilateral and bilateral agencies, and private sector. I welcome Ajit Fadnis. Welcome, sir. Then another panelist, our esteemed panelist is Dr. Ajay Pradhan. Dr. Ajay Pradhan is the president and CEO of Cetus Consulting Private Limited. It is known as C2S2, and has over 3 decades of experience in planning and designing and implementing infrastructure projects. He has been a consultant to the Planning Commission and a scientist in the Designing and Modeling Group of National Informatics Centers, Government of India. His key practice and research areas include technology intervention in irrigation management, mathematical modeling, river engineering, hydropower project, sustainable integrated water resources management, and so on. He is a member board of management at KIIT and KISS University. He holds the master and PhD in water resource management and engineering. I welcome Ajay Pradhan. Welcome, sir. Another, our esteemed panelist, Mr. Puneet Srivastava. In his career spanning for more than 25 years of work on a water supply and sanitation, had worked for a national and international project. He is a professional civil engineer with a master in ecology and environment. He has worked in a World Bank associated project. Currently, he is working on an urban wash advisor with a WaterAid UK program support with the unit based in London. He is a member of International Water Association. I welcome Mr. Puneet Srivastava for this panel discussion. Welcome, sir. Welcome. Last and very difficult to say introduce, Dr. S. Sundarmurthy. Yesterday I was talking to him and I said, sir, you are an encyclopedia. So for water and wastewater is concerned, sanitation are concerned. Very difficult to give an introduction of Dr. Sundarmurthy, but I just give a brief highlights. Basically, PhD from IIT Madras and former engineering director of Chennai Metropolitan and Water Supply and Sewerage Board. Presently a member of expert committee of Government of India and MAHUA for the India Water Supply Manual with GIZ assistant. He has grabbed number of awards over his career. To name few, A.V. Raman Gold Medal Award, C.S. Sastry Gold Medal, medal, Technologist in a Vishwakarma Award. He is an examiner and PhD guide. Very important. I should like to highlight that. He has implemented first city sewage to drinking grade water plant of the capacity 17.5 MLD and 12.5 MLD in Chennai. Really credit to that. And that was almost in the year 1995. He was the India team leader to MOUD and JBIC, that is for CPHU, for manual of the sewerage. Say warm welcome to Dr. S. Sundarmurthy, sir. And once again, I welcome all the esteemed panelists. Let us start the discussion with the, as I say, this as conveyed by the organizers. This particular discussion will be on a question answer session, and we will be focusing on, as I said, it will be a groundwater. What are the challenges related with the urban water supply, rural water supply, and definitely what are the government schemes are available, and what we can suggest. We have to finally come with some solutions, some recommendations, some suggestions. To begin with, as a part of a panel discussion, what I would like to say, summer is coming, and when summer comes, water becomes the essential commodity, very precious, particularly in India. And groundwater is one of the most important sources for the irrigation, or as well as in rural and urban domestic water supply. However, you'll find that overexploitation of this particular resource, valuable resource, has led into its depletion. So with this background, my first question to Anshuman. So Anshuman, I welcome you. You joined late. I have already given introduction, your introduction. Welcome. My first question to Anshuman, how you can justify need, or you can say importance of groundwater management in India? Welcome.
Sure. Thank you, Ajit, and good afternoon to everyone. Let me first kind of, mention where we are and why we need, groundwater management. See, if you look into our historical way, how we have used water, in particular groundwater, we have not been very judicious about it. If you look into the kind of overexploitation of the groundwater resources that has happened over the years, what we know is that the stage of groundwater development has been so that many of the areas, as assessed by the the groundwater boards is that we are overexploited state. I mean, if you look into, for example, Delhi, it's 170%, Punjab 145%, Rajasthan 125%, Gurgaon 311%. What does that mean? 311%. So it means, for example, that the amount of water we are drawing from the groundwater sources or the aquifer basically is 3 times more than what is being naturally recharged from the rainfall. And clearly, if we simply want to understand if our earning is less than our expenditure, then we are not going to be sustainably managing our kind of resources. And that's precisely the case of groundwater management in our country for various reasons. The groundwater tables have been depleting. If you look into the kind of over abstraction, as I mentioned, because of the increasing number of bore wells, probably not that effective regulation as well. The kind of cropping pattern we have, we need more water, cross subsidies, and so on and so forth. I mean, if you want to add, we can also look into the kind of vagaries of climate change to add to it. So all of that is basically what adds to the complexity. And if you look into the kind of state of our blocks which have been assessed, something around 6,500 blocks which have been assessed. What we know is around 10-11% are semi-critical, 3%, 4% are critical, and more than 15% are basically overexploited. And by the way, these are the areas where we have our economical activities quite very significantly in play. We still are the country who draws maximum amount of groundwater in the world. We are in the top, in the list of top 10 in terms of the groundwater resources. Next is China, which is half of us, even though their population is more. And then to add to that, kind of issue, we have the issue of, groundwater contamination from various kinds of sources, be it industrial or geogenic themselves. So you would know that a lot of our, aquifers, they face, issue of, fluoride, Rajasthan, Gujarat, Odisha. These are the places where you very commonly see this arsenic in West Bengal, Chhattisgarh, Bihar, UP, nitrate and iron in several states, salinity, especially in the coastal areas, salinity ingress, and heavy metals and pesticides. All of these are also the quality concerns that we face, as far as groundwater is concerned. So therefore, what I wanted to emphasize is unless we take cognizance of all of these as an issue and realize the fact that it is not an infinite resource at our will to just dig a borewell and start drawing, we will not be able to manage the resources very sustainably. Now, what you asked is why? So what we need to do? Simply understand that it's the kind of bank balance that counting that we do in our day-to-day life for financing. Whatever is available in terms of a watershed or an aquifer, we have to use it judiciously. Firstly, we have to improve our water use efficiency across the board, across the sector, be it irrigation, agriculture, domestic or industrial sector. But very importantly, see that we are not over-exploiting the resources, and we are initiating interventions which actually conserves or increases the water table. What are those activities? To start with the rainwater harvesting, groundwater recharge. A lot of these watershed activities, which actually, can make the groundwater either stable or increase over a longer period of time. We have done a lot of intervention. You would have heard about the Atal Bhujal Yojana by the Government of India, Ministry of Jal Shakti, where a lot of interventions are being already taken up. So I'll come to that probably in second round. If you want, I can speak about that right now as well. But all of these conservation-based initiatives, which are, about the groundwater recharge, groundwater conservation, I think these are the things which are required as of now in a much coordinated way. One thing that I wanted to emphasize very quickly is that not just the technical intervention, but what is very important for any initiative to be successful is involving the stakeholders right from the start, building their capacities and engaging them in the process of groundwater management. So I'll stop here. I mean, I can further respond based on the question. Thanks.
Definitely, I will come to you for the next round. No issue. Okay. So to be very frank, our another focus is what about the challenges for the rural, say, water supply and urban water supply. So to begin with, really say, you will find that, say, according to the recent report by the government think tank, that is what a Niti Aayog, this is a think tank for the government of India. They said that large number of India face the high to extreme water stress. And if this is the case, definitely the challenges on the rural sectors are different. Challenges at the urban sectors are also different. So we have to focus on both the issues. But to begin with, I'm just trying to take the issue related to the rural section. And for that purpose, I invite Mr. Puneet Srivastav with the question, what are the rural challenges of the safe drinking water in the rural sector particularly? Puneet ji, please.
Thank you, Dr. Ajit. Hello, everyone. The question that you have posed is a very important one. The first thing I would say that coming back to the discussion that was happening earlier, there might be some contextual challenges vis-a-vis rural and urban, but given the emphasis that Anshuman put up on the table about the groundwater, and groundwater is a common resource. The only thing is that we conserve more in rural and we exploit more in urban water because urban needs are huge. But having said that, I think the irrigation sector uses a lot of water in rural. But I think when we talk about the rural water supply in particular, in relation to your question, the first thing that we need to look for is in under which kind of environment this rural water supply works. So if you look at the policy and legislative challenges or the other regulatory challenges, especially related to groundwater, which is a major source both for rural water supply and irrigation as well in India. So free supplies for agriculture and free groundwater abstraction or self-supplies for the household water supply, etc. I think that is something which is which doesn't give a very good enabling environment for a professionalized service delivery by the service managers of the rural water supply, be it a Gram Panchayat, be it a village water and sanitation committee, be it a public health engineering department or any of the corporations that are responsible for delivery of safe and sustainable rural water supplies. So I think somewhere this environment of the free supplies, both in power and water for different other purposes than rural water supply, somewhere has a kind of create a roadblock in professionalized service delivery in rural water supply. The second is challenge is how do you ensure in a piped water supply the inequities in water distribution, particularly when you are planning and implementing unmetered supplies, where everyone is kind of charged in the same manner for different levels of service that they can extract from this water supply scheme based on their individual capacities in terms of putting more household pumps or being at the head of the scheme rather than the tail of the scheme, and also the serviceability issues within the water supply scheme. The third challenge, so inequity in water distribution is a roadblock in professionalized service delivery in rural water supply. The third is about water resourcing and quality. How do you ensure, because most of these schemes, which are single village schemes or localized schemes, are based on local groundwater based schemes. And as the groundwater situation, the grim picture that Anshuman painted earlier has kind of going on further in terms of water resource that you talked about in urban centers highlighted by Niti Aayog. The quality in particular is a major hit, and therefore the groundwater, which was supposed to be the safest and the best source for use in rural water supplies, has taken a hit in terms of water quality. High cost of current water quality treatment options at the local level and also at the household level, kind of is a major challenge for people, especially the poor, to gain access to safe water supply through rural water supply schemes and even hand pumps as such, on which still there is a huge population dependent on. The next challenge in rural water supply that we have seen is this debate between decentralized and centralized service models. What is good in terms of management of professionalized service of rural water supply, whether it has to be a small scale scheme at the single village level or a ward level or multi-village schemes or big huge regional schemes feeding from surface water sources from afar off places and covering hundreds of villages in its run. what is a better management model? And I think there has been an experience of various kind of management models from all these, from a very small community-based schemes to big schemes that we have in place in many of the states. But what works best in terms of the local management or local involvement of the stakeholders, and seeing that they are water use conscious and they are taking appropriate steps for water conservation and groundwater recharge, etc., etc. I think that is something which has been a challenge. So this has resulted into inappropriate management models that have not worked sustainably for safe water supply service delivery. And lastly, I think the more important thing is that the diversity that we have as a country and income levels of the people, how do we ensure that we have recognized the basic access to safe water supply? And I highlight this safe word here. How do we ensure that everyone gets basic access to safe water tariff, safe water supply without being unduly kind of or unaffordable water tariffs, and see that we have inclusive water tariffs in rural water supply that provides basic access to safe water supply to everyone, while working on the water tariff on the basic environmental principles of the more you use, the more you pay. So I think these are 4 or 5 major challenges. Lastly, I think the rural water supply challenge is how do we monitor and track the performance of the service levels of these schemes, and how do we get a feedback on the water delivery and water quality and water supply service delivery from the people or the whom these schemes are servicing. What could be an appropriate model that fits into the service supply system and the regulatory systems for continuous improvement of the public policies and the program on rural water supply? I will stop here, but I think these are some of the main challenges that we see in delivery of rural water supply and the environment under which these schemes are trying to work. Thank you so much.
Thank you, Puneet. Sir, you really nicely highlighted all the challenges. But what I would like to say, underline the concept is what? So that is what professional water supply delivery, professional. So professional approach is required. Safe water supply. So some of the very important issues we need to address that. Definitely I will come for the second round also. Say after discussing the rural water supply, definitely so far India is concerned, the urbanization rate is very high. And you will find that in India, it is a very fast process of urbanization. It is estimated that by 2026, the urban population will reach around 535 million, and that will give a big challenge for the urban water supply. Really speaking, with this background, I would like to pose the question to the Mr. Ajay Pradhan. What would be the urban water challenges in regional context, and what are the water security perspective in that particular aspect? I would like to request Ajay Pradhan, please focus it on a urban sector, regional sector, and within a brief time.
Thank you, Dr. Salvi. Do you mind if I just switch off my video because of the low bandwidth? I'll just switch up the video and I'll speak, right? That will be okay. Okay, thank you.
But try to restrict the time.
Sure. No, as you mentioned rightly, I think many other record that India is one of the most water-stressed nation in the world. And largely, I believe due to poor management of our resources, over-extraction of groundwater, and even uneven distribution of our rainfall pattern, which is called spatio-temporal variation in water and their availability. Let's look at water and its various components, be it excess versus shortage, supply and demand, use and availability, and sanitation. All are interconnected and have an impact on the economic development of our country. And as you know that you mentioned that India is one of the fastest growing urban population in the world, and we are going to the largest country in population wise, already been done, some people say, but by turn of this year probably will be the largest country in terms of population. As you mentioned that maybe 500 million people will move or will have urban population, and that poses actually greater challenge in terms of our urban water management in regional context. All urban cities, large cities, if you see that they need to really look at the regional aspects of their water supply system. And it is important to note that in most of Indian cities, I don't know if I'm wrong, but do not have a 24/7 water supply. But that I believe that Jal Jeevan Mission, which can rectify this and provide potable water to all the households across the country in the urban area, that would be, if that happens, this mission is success, I think this will be a game changer. If I look at the other aspect, actually, as I mentioned that urban water supply and security, it's not a the standalone or silo thing. It is a multifaceted issue. If the supply side is not combined with adequate demand management, alternative sources of water, widespread water wastewater management, treatment of sewage, and integrated circular system, our cities will continue to have this kind of problem. Therefore, if you look at Delhi case, I live in Delhi and I know Delhi how it is happening. We have always, last 20 years, we have a supply side is continuously increasing, but you see the gap is still that 30 to 35%. And that is going to continue in 2020, 2030 until you have new supply sources coming from Renukaji or from other sources. We still get water from 60% of Yamuna system, 30% from Ganges system. The rest are from groundwater, which is almost 80 to 90 mgd water we get from the groundwater. Still, we get more water from Bhakra and other systems. So therefore, one of the challenges, like many other cities, Delhi has at least some alternative water sources, other than many cities have single sources. So that is also one thing you need to look at challenge. Most of our urban infrastructure, civic urban, are in poor and dilapidated conditions. They do not have enough revenue or money to really maintain and manage. Even forget about paying, also salary is also not there. Even cities, actually, if you look at the other aspect is the water availability. Even in whole India, if you look at our total storage system is only for 30 days of rainfall. So look at the Surat cases. We had Ukai Dam upstream. Surat has a fantastic reuse, recycle of wastewater and to use for potable. Still, they face a drought in 2019. They have to cut the supplies and all. So there are cities which has sufficient water, but they don't have a sufficient alternative store system. So most of cities, they don't have so. Whether Mumbai, you get water from far off from Virar and other lakes and quite far off. All cities. Hyderabad gets 200 kilometers, Bangalore gets from Kaveri, all cities getting from water far out. And that's actually is the biggest problem. Now, Ajit, you mentioned that you have to highlight some of the challenges, what are the challenges in urban? Let me just point out that one by one. One is actually we still don't understand, we don't have a knowledge of water availability in the basin. We located in a geographic location, as I mentioned, we don't understand that what is available. We don't have knowledge of water availability, water usage, and future demand and all. So that's a big thing, knowledge gaps. Second was is our outdated infrastructure. And most of cities, we have less money than more problems. So therefore, we always do kind of a third one is ad hoc basis. Every approach we do in urban area, ad hoc approach. So that need to be changed. The third most important is actually socioeconomic stress. Every city is growing. Unplanned development, growth in Delhi, you see that we have so many jugis, we cannot provide water supply, we cannot provide sanitation. And that is where actually Delhi has almost, to look at Delhi and outer, it is 32 million people. Second largest city in the world. Delhi Jal Board supply only 20 million. So what happened to the rest of the people? We still don't have actually, and their sanitation also. So that's also another thing. And measure most of cities, that is what the socioeconomic problem. Undervaluing water. We really, as somebody mentioned, I think my previous speaker, service delivery cost. Delhi, we give 20,000 liter free to every, no charges. What happened to the sewage charges? You supply 20,000, but who is going to pay for the sewage charges? Who is going to pay for the electricity? Who is going to pay for the conveyance system, storage system, cleaning? So we have to look at water is that value as a service delivery. Don't pay for the water, but the services you have to do. So undervaluing the water is very, very critical. We need to look at. Lack of alternative sources. Look at Bangalore. Look at Hyderabad. What kind of alternative sources you have? In many cities, actually, in that purpose, except Delhi probably and few other cities. Look at Ahmedabad. Look at Hyderabad. They all have the similar problem. Then there is also, Delhi, as you know that, I mentioned to you that we have a political issue. Always we have a demand, more water, more water. So always demand on supply sides. We never really looked at how to really consume. Delhi, as per the standard, CPHO standard to 235 liter per person, LPCD, liter per capita per day per person. How do I use? I don't use more than 100 liter in a day. So therefore, why this 245 liter, 230 liter cities have been identified? They need to really change. So focus should be more on the demand side than the supply side. Ad hoc solution I mentioned. And then the last one, actually, Ajit, I would like to mention that we have a lack of coordination amongst policymakers. We talk of sustainable cities, we talk about integrated cities and many things, but we have several policies in governance system. They never talk to each other. I think I'll stop, Ajit, here for your next intervention.
Yes. Thank you, Ajay ji. So you're right, nicely highlighted all the challenges, particularly on the urban sector. Say, to be very frank, I am from, say, Mumbai. We are also facing all sort of difficulties and all problems. Say, after facing the challenges and all, we need to focus on the water security issue also. Different cities, and we have to see how the cities are operating, what planning they have done. Say, if you find that particularly city like Chennai, they have got a lot of problem related to water, but they have nicely addressed the water security issues by adopting different measures and all. Really speaking, this is should be we have to understand, we have to follow the good practices followed by the other cities also. Thank you, sir. I would like to go for the another question. Say, at the beginning, I started the discussion with the groundwater management and all. So that is a big issue related. Say, I'm coming to the Dr. Sundar Murthy, and rather than asking a very generalized question, I would like to ask a very specific technical question to Dr. Sundar Murthy, because when you talk about the groundwater aspects and all, you will find that groundwater depletion is very significant in India, and over, say, extraction of this particular problem or this groundwater, it is what the problem related to the depletion is day by day increasing. It is Anshuman has already pointed out the water quality also and all other aspects. I would like to ask Dr. Sundar Murthy one very specific and technical question. What are the dangers of the groundwater extraction, particularly in coastal region? The reason is what India has got a big coastal line. So what are the challenges there? What are the dangers there on groundwater extraction in coastal region? Dr. Sundar Murthy, sir, please.
Thank you, sir. I suppose I'm audible. It's clear.
Yes, sir. You are audible, sir.
Okay, thank you, sir. So basically, in the upper parts of India, fortunately, the rivers are able to give water almost through the year. In the south of India, we have, except for Godavari, which can be considered fairly flood prone, even Kaveri is drying up. So what happens is, with the absence of surface waters, as Chairman said, extraction of groundwater is going on mercilessly. But then, when we talk of coastal urban cities are all over the peninsula in the south. With the coastal urban cities extracting groundwater, we are inviting seawater intrusion. In Chennai, already as much as 2 kilometers of shoreline, from shoreline, I mean, seawater has intruded. Today, the average dissolved solids is reaching even about 4,000 to 5,000 milligrams per liter. The dangers are, these are affecting the foundations of the heritage structures. Okay, that let us leave it aside. Now, what can we do about it? The best way to do about it is to emulate the Orange County in California, where compared to Chennai, they have half the rainfall. And in Chennai, we are struggling with 100 LPCD. They are able to give 240 LPCD, and people use it even for car washing. The reason is the sewage is treated to an advanced degree and then blended with the bore water wells and injected along a series of injection wells along the coast, and then far inland extracted again. So it becomes a cyclic affair. I will show that. You can see it. I suppose this slide can be seen. It shows the cut section along the Pacific Ocean. We can see that the seawater intrusion is shown in the dotted line. It's shown there. This, they want to peg it at that point. It should not come inwards. So the treated sewage from the Orange County, as well as blended with some borewell water, is taken to injection wells, and it is injected into the identified coastal aquifers, various aquifers. And it is extracted again fairly inland in production wells. By this, it's a cyclic economy. Now, this is going on from 1980, and Mr. Chairman, right now I believe they are doing it something like 350 million liters per day. Now, next one I will just show what it is. Okay, now if we see Chennai, this is Madras city. This says the hatched portion, you will be surprised, is a former river course which has completely changed direction. This former river course is what we call a buried channel. It is lying deep. Now, compared to Chennai, you can see it extends that long for about 150 kilometers. Now, if only we can follow the Orange County example here and inject it along these coastlines, Mr. Chairman, you will be surprised. The storage capacity of this buried channel is 10 years of water requirement for Chennai city. So this is something we can try, but it's very difficult to put whatever you treated sewage into a freshwater old aquifer. So it requires a pilot plant. My honest submission will be, we need to take it up as a pilot plant. The ready-made geographical help is there, and we can try it. And this can be replicated in all coastal cities. Now, the next simple aspect will be, almost 80% of rural borewell extractions is for agriculture. And most of the urban sewage is either fully treated or partly treated, it's going out to waste. It can be treated and it can be taken to this agriculture, blended with some local borewell water. Israel is doing it. 99% of the sewage is reused like this, and they grow grapes from which they make wine. Yes, sir. Thank you.
Okay, thank you, sir. Thank you, sir. Sir has nicely introduced the issue also and given the solution for that also. It's a good example, particularly from the Orange Country desert of the California and how it can be implemented. Sir, please close your presentation part so that we can go back. Say with this, I would quickly go to the Ajit Fadnis. Say, I would like to ask question related particularly Jal Jeevan Mission. It is already implemented and it is on the say, it is end of say version is at the end of completion, having the target of providing tap connection to the 18.93 say rural household by 2020. My specific question is what? as JJM, that is Jal Jeevan Mission, is entering into the final year of implementation, what are the key challenges in this phase of program which need to be addressed to achieve the program goals of the national household connection? Ajit, please try to be precise. We have to manage the time because there is a second set of questions also.
Yeah, I'll try and be as brief as possible. Okay, it's a very interesting phase for Jal Jeevan Mission. If you know the kind of infrastructure being built at the speed scale, and it's almost reaching everybody in the country, every part of rural India with a phenomenal speed. And we are into the last phase of that particular program. If you look at the objective of Jal Jeevan Mission, it says that LPCD, 55 LPCD water through functional household tap connections. The functional word is very important. Mere tap connection won't work. Now the infrastructure is being built and every house is being reached with the infrastructure. Now there is a need to kind of focus, concentrate on the issues of sustainable service delivery. And if you look at this whole thing of sustainable service delivery, there are 2 or 3 things which are very important. First of all, and almost every speaker has talked about it, is about the source sustainability. Around 85% of these pipe water supply schemes are dependent on groundwater. So ensuring that the sources of these drinking water supply schemes are sustainable and delivering 55 LPCD for designed population, for designed period, perennially is a paramount task. On the other side, around 32% of the area, around 32% of the assessment units in India are under the category of critical, semi-critical, overexploited, etc. So there is some kind of a challenge for groundwater resources. So actually addressing these groundwater sustainability issues and having a focused interventions in a time-bound manner is first issue that needs to be addressed. The second issue is this whole thing is dependent on operation and maintenance. In urban, we might have the very well oiled infrastructure in terms of the machinery, in terms of the institutions, etc. But not necessarily it's always there in the rural. So second challenge that needs to be addressed is the operation and maintenance, proper operation and maintenance. Because, you know, in all previous programs, one of the major reasons of slip back is the poor operation and maintenance of water supply systems. So one is the source sustainability, second is the system sustainability. If you look at the O&M and its sustainability, then there are 3 components within that. One is it has to be technically appropriate management, so that it's not just kind of a respond to an emergency situation. Preventive maintenance, etc., complete protocol. Second is the institutional capacities. These are GPs, these are Gram Panchayat, village water sanitation committees, who needs to be capacitated. They're both for operation, technical skills as well as managerial skills. And the third part is the revenue management. How these schemes will run. You will need money, you will need resource, so that this entire O&M budget, tariff setting, etc., is going to be an issue which needs to be addressed, especially raising the resources for the operation and maintenance. And the last point is transitioning it to GP, Gram Panchayats, is also a challenge, because they are the ones who are going to maintain and operate those schemes. So how do you do that transition so they are enabled, they are equipped, and they have the capacity to run and manage those schemes? So these are the 3 broad areas on which we need to focus on. Thank you. I suppose I stuck to my time.
Thank you, Ajit ji. Really nice and crisp you have given. Thank you. Sir, I request all panel members that time is very short, and I would like to go for the second set of the question to all. And in the second set of question, I'm expecting some answers from suggestion, from recommendation from your end. So first question to again Anshuman. Anshuman, I asked you about the groundwater and related question. So Government of India already launched the Atal Bhujal Yojana and all. So how you can evaluate its effectiveness in addressing the issue in a very few 1 or 2 minutes? 2 minutes you can say.
As you know, this is a program in 7 states with 6,000 crore investment and 5 years duration, almost about to come to an end. See, any such program which is kind of taken forward, and this is quite comprehensive in the sense that and I would say one of the unique components of the program is also monitoring component, which actually has been by engaging the people at the Gram Panchayat level and of course district level. By developing a water sanitation plan and using the MIS system and so on and so forth. Now, as has been said earlier, I think what is very important is that we monitor what is being done on ground, and that's a very important component I would want to emphasize. So whatever program has been developed, how much recharge structures have been formed, their capacities, their actual kind of recharge as far as possible. Various amount of technical inputs will be required for that. It cannot happen in one go, but I believe the very basics can be at least done. We have done such programs in, for example, Punjab and Rajasthan and in southern Bangalore area. And what we know is that, if you are able to kind of rightly model and, design the intervention for example, pond rejuvenation or a groundwater recharge shafting in a particular area, you will be able to gauge what is the amount of input that you can have, the potential that you can have for the area. And that's something that can help, in gauging the success of any program. By the way, this is not just about the quantum of water, but also the O&M, which has been emphasized quite time and again. And I think in that sense, engaging with the local rural community and building their capacities and, bringing them on board as part of the initiative, having some ownership, kind of given to them is something that will be, the real success behind the, this large program that we have. There are many things that one can say, but paucity of time, I'll stop here.
Thank you. Anshuman, very sorry, but thank you. Yes, Mr. Ajay Pradhan, I would like to ask you how you can correlate sector for future growth and sustainability in connection with the Sustainable Development Goal 6 and SDG 11. Very quick and short.
Absolutely. I think you have asked the right question. The SDG 11, which calls for inclusive, safe, resilient, and sustainable cities, and this cannot be achieved without innovation in the water sector and leads to urban water security, as you rightly mentioned. And that calls for the SDG 6, clean water and sanitation. So therefore, just as water risk originate from multiple causes, different things, the effects of poor water security are widespread and cannot be solved in piecemeal basis. So therefore, you need this is an interconnected issue. This requires systematic approach to take into account the long-term policy planning and cross-cutting and multi-sectoral approach. Unless that is done, the complexity of challenges, which I mentioned that, including the nexus of food, energy, and which also bring in health, environment, and energy, as a the larger view of the community and country is required a very systematic approach. And as I mentioned to you that I work a lot on the technology intervention in the water sector. And very recently, I wrote and presented something called Digital Water Framework. And I call it the water, One Water, which is an integrated water management or urban water management. And that is where actually you bring everything, be it is a flood management, urbanization, water supply, you look at water food nexus, emerging technology regulations. So we try to bring that into a digital water, which is called One Water. And that is where actually you can address. We of course need data-oriented solutions, and that you require actually technology like a hydraulic model, digital twin. You need a blockchain, machine learning. For example, I'll give you. For example, in Delhi, we face regularly about the water quality problem. Because of the load, because of the runoff, agriculture runoff upstream, ammonia level goes up, or there is a wastewater releases. We can't predict it actually until it reaches. So we need those kind of technology to help in predicting and all. So therefore, technology is going to drive fast. You need a data which are people ready to invest. If there is no data, nobody will invest and all. The third aspect is actually, if you look all those things, policy, governance, and issues. Unless that happens, Ajit, I don't think, it will address this big challenge of growing population and urbanization. Thanks, Ajit.
Thank you. You really raised the valid points and need to be addressed and need to be taken in account. Yeah. Punitji, say community involvement and all, particularly operation and maintenance and all aspects, lots of discussion is happening about that. But I would like to specific question. As a part of the community, I'm pointing out the farmers. How farmer can be involved to save the groundwater? Is it possible or not? Your views, please. Again, in 2 minutes.
Yes, thank you. I would like to briefly answer this. I think you have asked a very specific and very nice question. No one knows the value of water more than a farmer whose entire livelihood is dependent on groundwater or a canal water. And similarly, like in household, no one knows the value of water more than a woman and girl who has to fetch water on foot from a distance to manage her household functions. But unfortunately, current policies and practices promote more groundwater exploitation in agriculture. And as I said earlier, free water and power for agriculture. So no active involvement of farmers in saving groundwater can happen without creating and enabling political, policy, and regulatory reforms that prevent unmeasured, unrestricted, and free water for irrigation. So, and at the same time, we have to think of the ways of incentivizing farmers who conserve or invest in augmenting the groundwater, because I think that is must for that common property resource. There are some incentives which are already provided under ongoing government schemes, such as construction of farm ponds, drip and sprinkler irrigation, etc., to farmers. But these are still in terms of their kind of take up. They are very less as compared to overall systems that which mostly is governed by the self supplies. Besides the canal system wherever they have their outreach. But their outreach needs to be expanded further. So for the involvement of the farmers, I think the farmers are also user of water at the domestic level. And in our experience, when I was working with Water Aid India, we did Jal Chopal with farmers along with households to help them do water budgeting that they are using currently for different crops, using participatory tools at community level, and challenge them to question their current level of water use, looking at their current water availability overall at the local level, their fall in groundwater levels as per their observations, and the impacts of climate change that they are feeling at the local level, which we have been talking a lot at the policy level. This has brought some awareness among them using their experience to measure the demand and supply gaps. I think many speakers talked about, the focus on the demand management. So, but this has to come from the people and the farmers as such overall, as you have pointed out in this question. So there are some good practices that have come up recently to connect farmers with awareness about groundwater and how they can track it effectively for managing their irrigation using the current technology that has been developed. We have been recently come across app that measures the groundwater, like Bhujal app, which kind of measure, anybody can measure their well water or bore well water with a mobile phone very easily, and then track it their uses on the basis of the fluctuations or the depletion in the groundwater level that is already happening. So, but without waiting for the massive policy or regulatory reforms, farmers must unite to save their most precious resource to farming, that is groundwater, and use of new technological advances for measured irrigation to be promoted at large scale. For that, using community tools just like the ones that we used in Jal Chopal earlier. Thank you so much.
Thank you. Sorry, because we have to finish it within a time.
I understand that. Thank you, sir.
Mr. Ajit Fundis, I was talking about I asked you question related to JJM. Quickly, now it will be 1 minute only. What would be the recommendation to ensure the flagship program like JJM and sustainable service delivery? So I connect you with again JJM.
Just two. There are a lot of things, but I'll just mention 3-4 things. One is, you should reach every source of every pipe water supply scheme, assess it, and ensure that there are interventions for strengthening the source. This is first. Second, create the protocols for the water budgeting at a Gram Panchayat level, operation and maintenance at Gram Panchayat level, revenue tariff setting and revenue collection system at Gram Panchayat levels, and train people. Reach out to Gram Panchayats with this information, with these skills and technical knowledge, That's also a very important part. And third is transitioning ke liye, for actually facilitating the proper transitioning system, you should have a very clearly defined process, which is there in Atal JJM. But its implementation and training the elected representatives at that level. See, I'll just give one small example and I'll stop. If village has to operate and maintain a scheme, they should have as-built drawings and they should know where are walls and all that stuff. So
yes, really,
let us at least ensure that these basic things are with them. And on the top of it, two issues. One is the capacity building drive for various stakeholders, and one is a communication drive so that people understand value of water, respect it. And the Indian culture says Malik bhi hum or Sevak bhi hum. That has to be inculcated, and that should be the message of the communication campaign. Thank you.
Thank you. Thank you. Nicely concluded. Last question to Dr. Sundar Murthy sir. Sir, again, I would like to specific. Say, my question, I talked about, say, groundwater to you. So now this second set of question, I'm very generalized and a specific question. How groundwater can be conserved? Dr. Sundar Murthy sir. Sir, please unmute.
Thank you, sir.
Sir, a request that we have very
yes, sir.
short time. So just try to be precise.
Conservation, as I said earlier, depends upon cyclic water use. Taking all the surface water and simply throwing it out as sewage doesn't make any sense.
Yes.
We must replicate Orange County, and the best thing to do will be to start a pilot project at Chennai. That will go a long, long way. Number two, let us think of using treated sewage with blended canal water for agriculture in rural areas. And we can involve people like Israel who have done it as a second pilot project. These two I will sincerely submit and recommend, Mr. Chairman.
Okay, okay. Thank you, sir.
Thank you.
Okay. Particularly second round of question, everybody was a very specific. I would like to request all, please put your video on. It will be a final round of fast session. I want only one-liner answer, immediate, fast. What can be your conclusion? What you will focus on? Whatever we discussed about the urban and regional challenges of a safe drinking water, with focus on particularly the groundwater and all. What you will say within a one word or one line? To begin with, yes, Anshuman, fast, one line.
Stop wastages and be more efficient in using your water.
Very good, excellent. Puneet ji. Puneet sir. Okay. Ajit.
Ajay.
Yeah.
Ajit Pandit, bolo. Yes.
Yeah, I would say empower Gram Panchayats and village level institutions to manage their water.
Okay. Ajay Pradhan.
I would look at actually one water, which is an ecosystem of water in a digital, framework. So digitalization, because world is going very fast.
One line.
Yeah. So,
okay.
so digitalization in water sector is the key.
Okay. Puneet Srivastava.
Thank you, sir. Respecting basic access to safe water and sanitation as a basic human right.
Sundar Murthy sir. Only one line, sir.
Yes, sir. Integrated surface and groundwater reuse.
Okay. Thank you. Thank you. All experts, really, you have given a very good insight, and it was a really good discussion. To be very frank, I also got lots of knowledge from all this discussion. So we will conclude here. So other second session, another session will start. So I really thankful to all panel members for your insights, your discussion, and your presence. Thank you all. So with this, I just hand over the moderator of the next session, Mr. Umashankar Mahapatra, Managing Director, Pulkra Chemicals India. Mr. Umashankar Mahapatra. And thank you for all.
Everyone.
Thank you.
Thank you, everyone.
Thank you. Thank you.
Thank you. Thank you, Dr. Salvi.
Yes, thank you.
Thank you.
So we wait for the panel members to join. I can. Umasankar Mahapatra. I am Managing Director of Pulkra Chemicals India Private Limited, which is having a history over 45 years into the chemical industry. So we are indirectly connected with the water because we service industries like textile, fibers, and leathers. All three are very high resource intensive in terms of water and chemical. So Pulkra and our group company Devon Chemicals from Belgium, so we offer various solutions which can reduce the water consumption during the textile, fiber, and leather manufacturing, and at the same time provide bio-based solution as well, so that the whatever discharge we do, that is less harmful to the environment, and also the product is less harmful to the consumers. By qualification, I am a textile engineer from Calcutta University and then master degree from IIT Delhi. So today's topic is really very, very relevant. I was listening to the previous sessions as well, so very, very insightful. So in today's newspaper only, I saw that water availability, the per capita water availability has gone down by 75% since independence, which is really a very, very matter of concern. So in the one hand, we have very low availability, and at the same time, we have over exploitation of water as well by all the stakeholders, by industries, by our agriculture sector, and by household consumers. So all the consumers are exploiting more water, and whatever water we have available, that is also getting contaminated very significantly by various due to multiple reasons. And that's causing your health hazards, biodiversity loss. So some of the panel discussion was also regarding that. So during our panel discussion, we have a very esteemed panel. We will try to deliberate some of the solutions, technology solutions, because our panels comprising both policymakers and also from a research background, they are having a industry implementation experience. So we'll hear from them what all new age technologies can be adopted so that we can really conserve our water resource and at the same time build up the infra so that we can reach out to every household with a safe water. So I would like to introduce the panel members, starting with Mr. Avinash Misraji. He is advisor to Niti Aayog and he is having 33 years of experience in water resource sector. By qualification, Mr. Misra is BE Civil and MTech Water Resource from IIT Delhi. He has been associated with various important committees and part of multiple publications in the journals and reports. So welcoming Mr. Misra to the panel.
Thank you.
Our next panel member, Dr. Sanjay Rana. He is the chairperson of Aqua Foundation. By profession, Dr. Rana is a geophysicist. He is a very popular trainer. I saw he is giving training in multiple locations within India and also outside India on this topic. He is MTech Applied Geophysics from IIT Roorkee. After working for 5 years in government department, he started first ever geophysics company in private sector in 1995. So congratulations, Dr. Rana, for that. And I welcome you to the panel.
Thank you very much. Thank you.
Then we have Professor A.K. Gosai. He is the Emeritus Professor, IIT Delhi Civil Engineering Department. He is also a member of National Green Tribunal, very important government bodies, other bodies like Ganga Act, and he is also reviewer of IPCC. He is the founder of a company called INRM, which was incubated at IIT Delhi. So he is part of multiple projects related to water and climate change. Welcome, Dr. Gosai, to the panel.
Thank you.
Nice to have you. Our next panel member, Professor Rabindra Kumar Panda, Director, Center for Climate Smart Agriculture, which is again a very important area we need to deliver it, which is part of Shiksha Anusandhan University, Bhubaneswar. Before joining this organization, he was part of multiple other academic institutes, IIT Kharagpur, and many other universities. So he has got over 40 years of experience in academics and research. Welcoming Professor Panda to the panel. Professor Panda, are you there? Yeah, we can't hear you, Professor Panda.
There is a message in the chat box by your Dr. Savan that he is having some technical glitch and he will be there shortly.
Okay. Thank you, Dr. Rana. And then our other last panel members, Dr. Pradeep Kalbar, Associate Professor, Center for Urban Science and Engineering at IIT Bombay. So he is alumnus of KIT Kolhapur, VJTI Mumbai, and IIT Mumbai. He has done postdoc at Technical University of Denmark as well. He has co-founded a startup, Ajivam Water Private Limited. So welcome Dr. Pradeep Kalbar to the panel.
Thank you.
So really we have a panelist, all expert in their field and having a vast experience related to water. So we'll hear from them during our conversation. To start with, I will have a common question for everyone. I think same question has been discussed during the conclave in the earlier session as well, but the viewpoints will be, I think, different from our panelists. So this is regarding what are the major hurdles in delivering piped water supply to every Indian household. This is in the context of ambitious Jal Jeevan Mission, for which target timeline is approaching, which is 2024. So what is your view regarding obstacle, in the implementation? A very quick 1 or 2 minutes. We can start with Mr. Misra. What is your view on this topic?
Yeah, good afternoon. Actually, to really go with the part of such a major task which we have taken up in Government of India, the biggest challenge for India water resources management is meeting the needs of 18% global population with 2% of global fresh water. And you see, even prior to providing the drinking water supply on the individual household, we tried earlier also, but as I have been associated with various plans of the Government of India, I have seen that we are never touching more than 96-94% of the coverage. This is because of the reasons of the unsustainability of the sources. The sources on which we are dependent is not sustainable. But now actually in this Jal Jeevan Mission program, we have gone with the multi-village piped water supply system, wherein the piped water supply will be there for multi-villages. And if you see the progress, then by 2019 we started, by now we have achieved something to the tune of 59% the coverage, and which we started somewhere close to 18%. So that way we feel that we will like to touch the deadline, which is 2024, but we need to really work on infrastructure to about 5 times more than that what is existing as on date. And also we have to tackle the sustainability of the sources, because still the 85% dependence is on the groundwater. So Jal Jeevan Mission, Jal Shakti Abhiyan, it was linked, then again catch the rain where it falls. then the funding under Manrega, which has been pushed for water storage creation and creating the artificial water bodies, and also rejuvenation and renovation of the traditional water bodies. So all this being done. But despite of that, I also feel that the operation maintenance, which will be a problem after some time when we achieve the 100%, the skill development is needed that we need to really inculcate in the people. So the functional house tap connection, once it is there, it should be serviceable. And furthermore, as there are 2,000 lab is on date for the quality testing and quality parameters. So those testing kits and the lab, all which is being provided, so there should be a focused attention by the community participation to really keep them going. So this is all what is needed, and these are all challenges what I feel that it will be required. We will touch the mark of 100% coverage to the household coverage, but it should also sustain thereafter. And also we should, I will say, little out of the box, that all our dams, all our reservoirs, there should be reservation of the 10% of water for drinking purposes, other than the irrigation. As we know, we are going for irrigation water usage to 90%. As on date, it is not like that. As on date, it is there. As and when the first priority will be for drinking water, that's good. But while there is a scarcity of water, when the conflict comes, then the muscle power actually prevails. So instead, there should be a 10% provision in all our reservoirs. So the water which is available to the farmer only up to this mark. So that needs to be done. I think that is what it is needed.
Thank you, Mr. Misra. We'll come back again to you. Dr. Rana, what is your opinion? What do you see the major hurdles looking at through the eyes of a geophysicist? What are the hurdles you foresee?
Right. Thank you for the question. And Mr. Mishra anyway partly covered what I totally agree with, and what the hurdles are, and he also covered part of how we are going ahead in the country about giving water to every household. I personally feel that it is also important to note that just having a household tap connection is it really doesn't mean we have achieved our mission, right? We also have to make sure it is safe, reliable, and it's available throughout the day. Now, for example, I live in NCR, I live in Noida, but it's still the water which I get from my tap, and Noida must be getting water for decades altogether, since the time the city has come in picture. But still, we cannot take the water and actually drink it, without treating it. It is so high in TDS, etc., etc. And many households still face issues of poor water quality, low water pressure, intermittent water supply, and inadequate infrastructure for wastewater management. So these are the challenges we are looking at. If you talk about the major hurdles which are impeding the progress, like first of all, I would say lack of infrastructure. When we talk about infrastructure, we are talking of reservoir, pipelines, treatment plants, right from source to the end user. Whatever infrastructure is required, we do not have, and many areas still do not have the necessary infrastructure. Even when we talk of source, for example, dams, like there is a big resistance towards having dams. Whereas once I come to the part of solutions, I'll talk about that in the world of climate change, you cannot avoid dams, because that is going to give you sustainable surface water storage which you need. Then poor quality of existing infrastructure, like even if we have the pipelines, etc., they have become very old. In Delhi, for example, I think we are losing something around 30 to 35% water to leakages. Then there is contamination. Sewer water is getting mixed with the water, drinking water, and such issues because of the poor quality of existing infrastructure. Then safe water sources, be it surface water, be it groundwater. Unless we are able to identify sustainable, safe water resources in different parts of the country, different areas, we will not be able to really achieve our mission. So this is another hurdle. Funding and resource constraint. Thankfully, Government of India is working on that, and various missions have been started to take care of that. There is some cultural issues, societal issues. Even, for example, when we started with a mission to toilet for everyone, there was a resistance to adopt to that, and many people still wanted to go for open defecation. Similarly, many people do not have pipe water as their priority, and their priority is something else, right? And last will be one topic which I think will be discussing in detail, and that is climate change. Climate change and natural disasters again pose a major challenge in delivering pipe water supply, especially in areas where you have more of droughts or floods, and that's a challenge and a hurdle which again we are facing. So it will require investment in infrastructure, in strengthening governance and accountability mechanism. That is my take on this.
Thank you, Dr. Rana. Coming to Professor Gosai, your views on this topic. How we can, what are the hurdles? Because we have very limited time, only one year left. It's a vast country to cover.
Thank you much. I think it's a very important question, and we have to be very serious about this. And as far as the infrastructure is concerned, I think many other things we can assume that we have the capacity to really take care of those. The most important thing is the sustainability of the sources. I feel that in the present situation of our country, where we have almost all the basins, if you look at the basin level, because that is where you can do the water balance. At the basin level, you have almost every basin is under stress, and that you can see also the reports of the groundwater board, that almost every basin you are having the declining groundwater tables. So as Mr. Mishra was saying, that the major source is the groundwater. By having this additional requirement put on the groundwater, you are going to have stress further aggravated. What it means, it doesn't stop that at the level that you are going to lose the groundwater resource, which is basically to be used very scarcely whenever you have difficulty. You are also having a lot of implications to the environmental functions of these water bodies, whether it's a river or whether it's the groundwater, because surface water and groundwater, they have interaction. And we have shown while doing the Ganga River Basin Management Plan that because of your over-abstraction of the groundwater, you are losing water from the rivers to the groundwater, which is not visible unless you do the modeling and you prove it scientifically, which we did. So I think this is a very serious issue, and it shouldn't happen that we have put the infrastructure in place. The tap is there, but there's no water. That will be a very serious situation. What I had also suggested to the ministry, that you should take up this in a manner that first you prove that from where this water is going to come in a sustainable manner, and you can put on top the climate change implications also. We are doing a project under the GCRF, which is the Global Challenge Research Fund from UK, where we are looking at the water security of Delhi. So we are starting with the Yamuna as a basin, which is a source for majority of the water supply to Delhi, and looking at the future situations, how much will be the reduction in water? I think in the present situation, when the government is looking at providing the water to every household, we should first showcase through the proper studies that we have that water, which is going to be extracted either by enhancing the water use efficiency of the agriculture. Let them first prove that it's gone to a level where you have some additional water, spare water, to be used for this purpose. Wait for that time. Don't make it a political agenda and then provide the tap which is not going to provide water. I feel that is the most important thing to be done by the country, that make all these calculations that this is the amount of water which is required, and put all those reuse and all those other requirements also, at the city level, but prove that if you want to have this additional water, this is a source which will remain sustainable, and also not hampering the environmental functions of the water systems.
Sure. Thank you. Thank you for highlighting that, using of futuristic model, factoring in the climate change is how significantly can impact. So these are really very, very critical inputs. So coming to Professor Panda, I hope you can hear us.
Yeah.
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 So,
can you hear me? Yeah.
Yes, very clear.
Yeah. So, yeah, let me tell a few things. My previous speakers, they spoke on the availability, mainly sources, major sources. I would say I would look at the demand side. So unlike the major cities, big cities, small towns and villages, the households are very scattered. So that way, supplying to those households from major sources would be a challenge. In the sense, it won't be economically viable and a lot of losses will be there. So the solution would be if we, develop or locate in situ sources like, if we have groundwater availability. So if we can use that, groundwater source is one. Otherwise, we can store or conserve rainwater, then reuse that with some filtration or recharge the groundwater by the rainwater if groundwater is not sufficient, and reuse that for scattered small households in small towns and villages. That would be a good solution. So I'm not elaborating on the source side. This short.
Thank you, Professor Panda. Coming to Dr. Pradeep, what is your take on what are the major hurdles in this mission?
Thank you. As many of the experts said, source sustainability is one of the issue. Yeah, that is one of the issues. But I also seen at many locations where water is there, we do not have good distribution systems. We have a lot of issues with the losses in the system, in the networks. We have inequitable distribution, and reliability of distribution is very low. So people have to store the water, and that creates a lot of problems in the performance of the networks. So for example, people have storages in the households, and people will not leave away storages because we do not have reliability. It will take a lot of time to convince people to get away with the storages, whether it is cities and rural areas. So we need to really rethink the entire delivery of pipe water supply systems. We are basically adopting, consumption pattern of, 24/7 fashion, and then trying to impose it on the ground. Whereas in the ground, you have very limited supply of 1 hour or 30 minutes. That particular smallest pocket of time, distributing water is big challenge. So a lot of work needs to be done on that side also. So, and Jal Jeevan Mission, taps may come, pipes may come, but then there will be a lot of retrofitting will be needed if you want to bring equity and reliability. And that will be the future challenges. Thank you.
Thank you, Dr. Pradeep. So I think we have seen the different hurdles in the implementation phase. Now coming to the solution part, what all innovative technologies as a stakeholder, various stakeholder we can provide so that we can make it a success. So we'll now hear about the various solution part, and we can start with again Mr. Misra on the policy framework. What are the policy intervention as a Niti Aayog you are doing to support this mission? So very specific in 2-3 minutes, if you can highlight some of the key policy intervention to build this infra. So whatever hurdles we have, we can really come out of that.
As far as policy interventions part are concerned, I can say that the first intervention which is needed to minimize the use of water in the agriculture sector. Today, the agriculture sector is consuming something to the tune of 90% of the water. Maybe it was a little more than that rather. So first to economize and rationalize the water in agriculture sector. And after that, the furthermore, the policy interventions which would be required, that the pricing of the water. You see, the losses, what we are incurring in the transmission and distribution losses in urban India, we say that to a non-revenue water, which is something to the tune of 35 to 40%. So that should also be rationalized. And why we need to really to see that this water which is being provided to our houses is not adequately priced. If we break down the prices, it is the some sort of investment made at the source and some sort of investment made in the service. So at least the service part should be paid. So this is a major issue which I think where the policy intervention is required. The other thing which is again there, that the dependence, the over dependence on the groundwater, that also need to be minimized. And what to do for that? Actually, for minimizing the over dependence on the groundwater, we need to revive the traditional water bodies. We need to see in what way the water can be conserved in our users part, in our water footprint part. So that part also, like you might have heard, the government of India has initiated the Sahi Fasal Yojana or Sahi Fasal the scheme. So that part is again which is needed. Then the community participation. You see, community participation is very much needed. It's the participation with the panchayat. The Atal Bhujal Yojana is such, because I'm again focusing towards the groundwater, because the groundwater is the mainstay. The water is available just at the fingertip of a farmer. So he puts it on and uses the water. So there should be aquifer and aquifer management with a piezometer system. So the community must know that this is the water which is available to me during the pre-rain, and post-rain this much is the level which has risen, and I am supposed to use this much of water, or the community as such is supposed to use this much of water. So that is again required. Then as Niti Aayog has also tried to inculcate the system of the management of water, that is the composite water management index, wherein we have indicated that water should be managed at source, it should be managed during the distribution, and it should also be managed at the demand side. There is required the policy parameters. The policy parameters may be wherever and whenever the water is falling, it should be really trapped, whether it is rainwater harvesting, or it is the village pond scheme, or it is the farm pond. So all we should really effort in that way. So these policy parameters I think is required. As far as the investment of the government is concerned, I believe the investment is quite good in terms of the water sector. If we put together these Swachh Bharat Mission, Gramin, Urban, and the Jal Jeevan Mission, and the Pradhan Mantri Krishi Sinchai Yojana, all put together, it makes around 10 lakh crore for a period from 2019 to 2024. I think this is the first time when such a major investment has been made. While I interact with the other representatives of the countries, I experienced that the type of the budget what we made towards the water sector is too high, and the water sector, if we see particularly with the sustainable development goal, so goal 6 might be directly related, but we are also related to many other goals. Those could be something to the tune of 15 goals. That's zero hunger, the good health, sustainable cities, and sustainable consumption and production, and life on land. So all these are
interconnected.
Those are
interconnected.
With that, I think these all policy the part is to be paid attention, particularly the water pricing part, particularly the water conservation part, particularly the rainwater harvesting and rainwater this part, as well as the dual pipe system, if we can put it on use. And the major thing, which is that wastewater we are still not using. We are the single water user. I think that should be avoided. We should not remain anymore the single water user. We should be multiple times the water user.
Thank you, Mr. Misra. I think as an industry, I can relate. Now industries are most of the places in the country, we need to either ZLD is now the norm. So every industry now, being encouraged to put the ZLD system. So full circularity in the whatever water we use in the industry. So coming back to Dr. Sanjay Rana, so being a geophysicist by profession, if you can throw some light on how geophysics can help in public water supply infra. And also, as an extension to my question, as a country, are we really using this expertise and skill set available in this area? So I could see multiple news, so your take on that, whether we are really utilizing this expertise while designing the system of water infra.
Thank you for your question. And I answer your second question first. No, we are not. We are definitely not using the technologies to the extent we should be able to use. And I'll start answering your question with where Mr. Mishra left, for example. He was saying that, a user should actually know that based on the rainfall in the area and the groundwater level in the area, how much he should be extracting, etc., etc. The point is that do we, as the policymaker or as the technocrat, even have this data that how much we can allow him to extract? For example, Agriculture Ministry gives subsidy to put the pumps to the farmers to extract groundwater without any consultation with the Water Resource Ministry, whether they have done any study, whether there is enough water to be extracted to actually feed all this agriculture. So we have some serious issues in terms of groundwater modeling. And that's where geophysics can help in a very, very big way. First of all, when we talk about groundwater exploration, okay, so there are various geophysical methods. I have no time or intent to go in details of that, which can give you location and depth of the aquifers, then quality and quantity of water they contain. And this information can be used very scientifically for designing and optimizing the well and borehole location for extraction of groundwater. Then very important is aquifer characterization, okay, to map the spatial distribution of aquifers, identify the properties like permeability, porosity, hydraulic conductivity, etc., etc. This is essential for designing effective groundwater extraction system and understand how the aquifer system responds to pumping. I did a project maybe in 2001 somewhere in Oman where we did a lot of geophysical studies and finally created a groundwater model. And the idea was that we should be able to do what if studies. That let's say if there are 3 years of drought, how much water should be extracted? If there is this much of rainfall, how much water can be extracted? So that kind of models, unless these are available, and for which you need a proper mapping. There is a national aquifer mapping project in place. I'm aware of that, but still a lot is to be done in this. Then leakage detection. In your pipelines, you have leakages, and there are methods, very advanced methods, which can be used to detect these leakages, and then you can plug these leakages. Very simple thing, right? And it can really improve the efficiency and effectiveness of the water supply system. Coming to surface water, we are hardly able to make new dams, but dams are important. So existing dams, like geophysical methods, again, are very useful in doing a very quick health checkup of the existing dams. And if there is any weaknesses or some few zones which need some treatment, these can be restored and rehabilitated very quickly. So at least we are able to save what we already have in terms of dam infrastructure, even if we are not able to make new. So there are various points where geophysics comes in very handy in giving these solutions in terms of aquifer mapping, aquifer characterization, groundwater modeling, dam safety, reservoir sedimentation studies to see how we are losing the capacity of reservoirs. And then when it comes to actual pipeline laying, again there are a number of methods which help in terms of what material of pipeline should be used based on the soil characteristic of corrosiveness, what is the right route based on depth of rock, etc., etc. So it's a very, very vast topic, but these techniques really have a great role to play in this public water infrastructure, and unfortunately, they are not being used to their full potential as of now.
Thank you, Dr. Rana. So I think two important topics you highlighted. One is the interdepartmental or interministry related coordination, which can really help our efficiency, and also adoption of latest technology and tools to improve the efficiency. So very, very valid points raised. So coming to Dr. Pradeep, you are from IIT Bombay, and your center is specifically working on center and urban related area. So if you can highlight some of the projects or some of the innovative solutions you and your team working on, that will be really useful.
Thank you. I will use a short presentation for sharing the ideas that we are working on. So can you see the screen?
Yes. Yeah.
So basically, what we are working is to deliver at least minimum water, bare minimum water to the households. Because with the current design and systems, supplying water equitable manner and with reliable manner is very difficult. Because current water supply systems are trapped in the vicious cycle. Infrastructure condition is poor, then service, which affects the service quality, which affects the consumer satisfaction, which leads to a poor revenue generation, and which again affects the operation and maintenance. And we are again back to the square one, infrastructure condition is poor. So we are basically trapped into this particular system. So no amount of, you can pump new infrastructure in the systems, but they will come back to the original if you do not have this all aspects fixed, and a lot of stakeholder participation, policymakers, governance will be required. I am working only on the technology side of this particular entire big problem of public water supply provisioning. What is happening is our design systems are failing because the supply is very limited, whereas the withdrawal is very high. So if you see the withdrawal in the cities, is tremendous because there are no metering, there are no controls on the withdrawal. Storage is very high. As Mr. Raja said, the pricing is a big issue. We are not pricing the water correctly. So whatever we design, it doesn't operate in a particular manner. So tanks get empty, and further the HL drops beyond standing water column. And many of these tanks are bypassed. So this infrastructure is bypassed, and many cities are operating directly with the pumps, which is affecting entire transmission system side also. So what is happening is we are designing system assuming this kind of consumption pattern, that every rural or urban area will have this kind of consumption pattern with peak factor theory. But in between there are storages, and consumers have periodically invested in the household storages, and whether it is a very small rural area in Maharashtra where we studied, a lot of storages are there. So how we can respond to this with the technology of pipe water supply is very, very essential. So our hydraulic designs model have to take into account these uncertainties. And then we have developed a particular hydraulic modeling approach suitable for Indian conditions, because current design practice by consultants takes a developed country approach, which is not at all suitable to our country. And it shows that if we follow this the correct methodology, we can show how much demand is not met for many consumers. You can see the zeros. That is when you have appropriate design methodologies. So aim is to bring equity first and at least provide 10 liter per minute water supply to the households, which requires less monitoring, consume less energy. And decentralized infrastructure can be one of the approach, which many of the practitioners now adopted after we have worked on this particular idea. So what I'm suggesting is to have a small distribution tanks with the multiple outlets. And this idea has been taken up in many cities now so idea is from main storages, we can have multiple outlets so that all the different variety of topographies can be tackled separately. And one's problem does not become another's problem. Like this area is low lying, if there is fetching more water, this area should not be affected. So multi-outlet, we have also proven why it is essential to have it in Indian context. Another innovative solution is a shaft, which is you can avoid storage tanks at many locations. And basically we can, we have a lot of tanks being constructed, but those are getting empty. So instead we can construct a shaft because many municipalities are bypassing these tanks. So what we can have is in between we can create this hydraulic isolation structure. Technically we call it hydraulic isolation structure. And this we have demonstrated with DST funded project from 2017 to 19, and which is successfully now operating Safari Town near Mumbai, which is low cost, indigenous, local, and which has multiple outlets, can be constructed in the consumer area. So finally for the cities, what we are working on is use the storages because city needs a lot of water, and in front of that create a shaft with the multiple outlets, and HL can be controlled by the same system on its own. So a lot of innovation we have done, and we have now have a startup company which is providing these solutions. So that's all from my side. Thank you.
Really, very interesting, Dr. Pradeep. So coming to Professor Gosen, you have incubated a company, INRM at IIT Delhi, which is working on multiple critical areas like climate change, precision farming, city planning, water security, etc. I also saw your climate change information portal, which is really very, very resourceful. So if you can share some of the projects related to improving water infra in the country, that could be really useful.
Is it addressed to me?
Yes, yes, Professor.
Thank you. I think going back to the questions which was being addressed by Mr. Mishra about the water security and the water availability. See, what we have done in this NRM, we have created the digital twins of all the basins, where we are trying to assess the water resources, because every basin is not similar. So you cannot expect the same water equity across the basins, because the quantity of water which is available in different basins is different. And in Rajasthan, you cannot expect the same kind of water availability. So what is required to be done is that you have to first look at what is the resource availability, how much is the demand which we are imposing on the basin, and we are going to the simulation mode, where we are looking at, the good thing about the simulation is that then you can generate scenarios. That if you change the cropping pattern or you change the irrigation method, how much is the water which is going to be available as a demand management option, which is part of the National Water Mission. Now, I think saying that 20% efficiency increase we will do, I think we have to also realize that to implement this 20% increase in efficiency, especially in agriculture, let's say, you have to change the methods of irrigation, and that needs investments. Is our farmer having that kind of sources or the resources available with the financial resources available with him that he can invest on his own? That is, I think, is the major issue, that you don't have their capacity, and they are going in for whatever they have been doing for the past many years. So I think here the government has to come in with the investments, with the kind of subsidies that, okay, we'll invest in infrastructure, and this will give you enhancement of the efficiency without having any impact on your yields of the crops. These are, I think, some of the things. Similarly, when you're talking of the groundwater management, we have to start looking at what is the groundwater level which should be there in a particular river basin, which is bringing the water from the groundwater into the river to make it more sustainable. And that is the natural part of the natural system, which these river basins were playing, and the groundwater was appreciating during the monsoon and providing the additional water through the lateral movement into the rivers. That has stopped. Now we are talking of the environmental flows. So how much should be the environmental flow to have all these things? So all this is being done in the simulation mode, and we are having some of the basins taken through the GIZ with the Government of India, the EU effort, where they have taken TAPI, where we are showcasing that how the river basin management should be done at that level, engaging all the people, and then which are the scenarios which will bring the hydrological health as the first priority, and then the environmental health of the basin back into what was not the pristine level. At least you can reach, you know that this is the level to be attained, and that is the target set for you. You might not be able to attain that what was there 100 years ago. So those kind of projects. Then we are presently doing another project which is for taken up by the EU again with the Government of India from Ganga Basin, showcasing the same thing in a different setup. So there we are also doing the groundwater surface water modeling, and then looking at the groundwater surface water interaction. so that we can bring back the health of these basins back. And then you can quantify that how much is the requirement of enhancing the water use efficiency. That's one demand management option. Then how much is the reuse possible at the urban areas level. And in the case of Delhi, in this project which I mentioned, we are looking at all the systems which are related with water, whether it's the water distribution system, the sewerage system, the sewage treatment plants, as well as the stormwater drains, the stormwater system, because all these three, they interact with each other. And most of the problems are because of the poor management of the sewerage system in Delhi. Because in Delhi, as part of the NGT Principal Committee, what we saw after taking the information from the people, different departments, there are 11 departments in Delhi who are maintaining different sizes of the drains, stormwater drains. And we found that not even a single drain, which is a natural drain, all these are natural drains, is free of sewage. They are all running with sewage. So what kind of system we are having? We are having the pollution created by mismanagement of the sewerage network. Still around 45% of the Delhi is not sewered even. There are then the unauthorized colonies, the Jogizompi colonies, which are creating sewage and is not being handled properly. So the pollution of Yamuna cannot be handled if you don't recognize the sources of pollution and then plug those sources. If you do that, then that was a major bone of contention between me and the Justice Satendra Kumar, because he said that why can't we collect all the wastewater just before it falls in Yamuna and then take it outside the city and treat it and then be done with it. The Yamuna pollution will be over. I said, no, that is not the question. Question is that what will happen to the mini Yamunas, which are in the whole setup of Delhi, the whole landmass of Delhi. There are around 200 natural drain segments which are there in Delhi, where people only talk of 22 drains which are outfalling in Yamuna. So unless we clean all these 200 drains and make sure that no sewage goes into these drains, we will not be effectively tackling the solution of pollution of Yamuna. So those are the things we are still doing that work, and we are trying to see the bigger question in Delhi. I mean, as part of our research which is going on, nobody knows that how much is the usage of groundwater in Delhi. You have some water coming from Yamuna, some water coming from the Indus, and some water taken from the ground, and even Ganga is also providing some water to Delhi. But there is no figure that how much is the water taken from the groundwater illegally or legally. Because Delhi Jal Board is extracting a lot of water. That number is not known. So we are going very systematically. We are looking at how much is the water supply going to different water supply zones, and then using the overlays of the GIS overlays analysis, because water distribution area is a different polygon. The sewerage network is a different polygon. So then overlaying them and finding out that how much is the amount of sewage generated by a particular area going to the particular STP. So there are situations where we have less water supplied and more sewage generated. That is not possible. So that is giving us a handle on how much is the water which is taken out of the groundwater, because that is the only additional source taken out of that. And once we have that, then we'll be in a position to really find out the proper solution, that if this is the situation, how much is the reduction in the lacking, how much we are lacking in the capacity of the sewage, how much additional sewerage network is required. And with the objective of 2015 January order of NGT was that in Delhi, no sewage should come into any of the natural drains. And that is being implemented by DJB, though it has taken, it was supposed to take only 3 years. It has already taken more than 7 years. Still is not completed, but now we are with the NMCG. we are trying to make a portal where all this will be evaluated, not with the expenditure of money, whether the money has been spent or not, because that is no evaluation. We are trying to showcase that whatever it was, the money was spent for, what result it has produced. So we're going in for different kinds of quantification, that if interception has been done, how much is the reduction in the sewage which has happened, and how much is the change in the water quality of the Yamuna. So there's another project which is very interesting project which is going on.
Thank you, Professor. I think in the interest of time, I have seen your website, a lot of interesting projects I could see. And I could relate as an industry, textile industry is known to be the second, highest polluter of, water bodies. So we are part of the system. Next to oil and gas, I think textile has a major role.
If you give me a minute, I'll also tell you about something, because convergence is the key to, if you really want to tackle water properly, the convergence is the only way. You have to do the convergence of information. We have done another project for GIZ where we have looked at the climate change implication to the MSMEs of India.
Okay.
So there we are looking at the total value chain of 3 sectors we have taken. And that is another very interesting work which has been done. And we are coming out with a portal which will mark all the clusters of a particular sector of MSMEs, because that is where the adaptation on account of the climate change implications has to be done effectively.
Thank you, Professor. Coming to Professor Panda, I think agriculture is always being talked, the 90% of the water being used. And you are part of the center where climate smart agriculture is the main topic of your center. So what all activities you are doing at your center to make this sector?
Pick up some of the points mentioned by Mr. Misra and Professor Gosai. Actually, at IIT Bhubaneswar, we did 2 major projects, multi-institutional projects, under one project, because one of my area is groundwater resources. So one thing is, like, agriculture consumes a lot of water, that is fine. But most of the agricultural area, arable lands, they are rain-fed. So groundwater is utilized for agriculture done during the winter. So the area covered is not very high. So maybe less than half of the arable land is covered under groundwater during winter for irrigation. So then coming back to the groundwater utilization, proper utilization, as Mr. Misra mentioned and Professor Gosai mentioned in a way, we did some case study in a big groundwater basin, which was underlying in a major watershed, about 500 square kilometer watershed, and underlined by that was the basin of 450 square kilometer. So there we did intensive monitoring in 86 wells for 2 years, and those data and other secondary data like other monitored data on soil and land use and rainfall, and how much water is discharged, utilized, things like that. Then finally, with all these information, we developed several things. Mainly one app was developed, which was tested in that basin, 450 square kilometer. Then that app could identify the challenge which Mr. Misra and Professor Gosai was mentioning. Groundwater utilization main challenge is to know where should we have drilled the well. Okay, so then we found out, we mapped the potential areas which has potential for storing, high potential for storage, then potential areas where we can pump out water, which can yield groundwater and which can store. Sometimes they overlap also, that is the best area. Then we could identify the locations if somebody asks. So this app will give answer, which are the zones which has high potential for storage, which are the aquifer zones which one zone can contain one or multiple aquifers, so which can emit water, high quantity of water. Then that app also will say how much discharge can be done. So where to install a single well or multiple well system, then how much the well can discharge, then the design of the well, single well or multiple wells. So a detailed design it can give. So that was tested in Maharashtra. There is one in the Satara district. We had one Indo-Israel project. It is again multi-institutional project funded by Gita, one arm of DST. And then there was a Israel partner, Axop company. So here we had this, we had Datametrics was one of the partners. Then we had one NGO in that area, Satara district. So we adopted few villages there. So we found using this app and other techniques, of course, technical intervention, technological intervention, we could enhance the availability, water availability, like more of recharge of the rainwater. Then water availability was increased and more area could be brought under crops. So that way, total utilization, mainly the target of this app is to utilize in one statement, I can say optimum utilization of groundwater, which is a challenge. So let me admit, all said and done, at different level, nobody admits, let me admit, the challenge is the assurance level. So if somebody, any expert, if he says, you dig a well here, this much yield will be there, the aquifer, we'll go for resistivity survey, whatever, but they are not 100% sure. But
thank you, Professor Panda. I think we have very limited time left.
75% assurance level we could get. That's it.
Thank you, Professor Panda. I had the opportunity to visit some of the agriculture institute in India and also in Israel due to the cotton cultivation related topic. So it's I think a great area you guys are working on. So as a closing remark from everyone, how do you see India positioned as compared to the other countries, both developed and developing countries? Very quick, half a minute comments from everyone, then we can close this session. We can start with Mr. Mishra with very specific, if you have some highlights.
Yeah, it will be very specific. You see, as per let us pick up the Sustainable Development Goal 6. Here we are going to complete the target by 2024. And if you see globally, then 2030 seems a little difficult for many countries. WHO indicated 54% is the piped water supply level globally. However, 59% we have got in the rural India. So that is there. In case of Swachh Bharat mission, we have already achieved, and whatever remains will be done by 2024. So we are way ahead globally.
Thank you, Mr. Dr. Rana, what is your take on our global position here?
Yeah, I'm an eternal optimist and eternal cheerleader of whatever we have been doing. So we have done a lot, but definitely there is a long way to go. When it comes to compared to developing country, definitely we stand very good. We have made very impressive strides in improving access to basic water supply. When it comes to developed country, we still lags behind as far as universal access is concerned. Like countries like Japan, Germany, UK, they have actually achieved universal access of piped water supply, and we are lagging behind in that. So we really need to invest more in water infrastructure, water management and governance, conservation, efficiency, etc. And to manage something, we need to understand that. So once we talk of groundwater, understanding aquifer remains, as far as I'm concerned, the first priority, where still we are lagging behind. And of course, we have to, make our dams also safer and our water storage even more robust.
Thank you.
Thank you.
Yeah, Professor Gosai, your comments.
Yeah, I think we are doing okay, but I won't say that we are satisfied with that completely. What we need is the convergence is the key. We have been saying all along that we are doing the integration. I think it's more on paper than the actual integration. It should be on the ground. We need to have proper evaluation systems, which are now possible with the technology. And the good thing is that people are very good at technology. And we need to really, sensors have become very, very cheap. So we need to bring in the systems approach to really understand that how well our systems are functioning and where the lacunas are, so that we can plug it properly. Unless we know that what is the evaluation, what is the performance level, you cannot even know. You can only look at by the expenditure made. That is not the way evaluation should be done. So I think we need to really invest in the proper evaluation of our systems.
Thank you.
And we'll be there.
Thank you. Yeah, Dr. Pradeep, your comments on our global position in terms of water security.
Yeah, so we are making a lot of efforts in terms of infrastructure provisioning, but I think focus has to be leapfrogging and not following what developed countries have done, because even if you see their systems, they are failing. If you see the affordability, even in US is not there. Continuous water supply systems or highly centralized infrastructure. So we are basically have to tweak the solutions for our own territory as per our local context. That should be the focus than just adopting solutions which are not at all fitting to our situations.
Thank you.
Opportunities are there to make that happen. Yes.
Professor Panda, any closing comments from you?
Yeah. See, our challenges are more than other countries, in the sense our mother of the water source is the monsoon, which due to climate variability, the availability of water is changing. So we should have climate smart system, okay, including climate smart farming. So far as supply is concerned, it has to be location specific. So we can't go for generic here. Our locations are very specific challenges are there. We have to address.
Thank you. Thank you, Professor Panda. So with this, we close this session, and it was really interesting to hear all of you. I thank everyone for really interesting insights. Thank you. Thank you, everyone.
Thank you, Mr. Mahapatra.
Thank you very much.